so we will be doing this a little bit, but.
No, why don't you take this one?
No, I think this is the way they want to do it, so. We just need to remember to turn the mic back and forth if you're sharing a mic with somebody so that you're talking right into it so that they can pick us up on TV. And is this working?
Take us,
Okay.
yeah.
Okay. I'm calling the meeting to order. Welcome, everybody. This is our joint meeting with the Children's Trust. We have a pretty good agenda here today, so we'll get started. I'll offer Chair Pinkinson, I guess you are, a chance to also welcome everyone.
Well, thank you first, Chair, that we appreciate the opportunity to come and share our thoughts. And you're right, it is a relatively healthy agenda, so I will keep my comment short, and it's nice to see everybody. Thank you.
Move approval of the stacked agenda, Commissioner Pinkerton.
Have a motion. Do we have a second?
Second.
Do we have any public discussion? We don't have any, so all those in favor of the motion say aye.
Aye.
Those opposed? Motion is unanimous.
Motion
Madam
to
Chair?
approve county agenda.
Second.
Motion and a second. Do we have any public comment on the motion? Seeing none, all in favor of the motion signify by saying aye. Aye. Any opposed? All right, we have an agenda.
Well, Madam Chair, we're zooming up to this point, so.
Oh, yeah, no, we're making good time. We're making good time. So the first item here on the agenda is access to health care for youth update. And let's see, who is doing?
That was something that we put on the agenda, and our wonderful executive director is going to enlighten everybody in attendance about what we're doing as far as healthcare. Gotta live up to that after that.
No pressure, right?
No pressure.
I'm assuming I just talk into this. I don't have to press a button.
That's
That is correct.
Okay, good afternoon, everyone, and thank you, Mr. Chair. The purpose for us adding the youth health proposal onto the agenda was really just to make sure that you all were aware that we have incorporated the community health worker into our request for proposal. We are certainly aware of the work that you all have been doing with this program. We believe in the program. We are hopeful that the folks who will be applying for this youth health proposal will be incorporating it into their plans. The plan for the proposal is for us to look at dental health, children's well-being. It's a number of different areas and avenues, and it's including healthcare in the city, but in our rural communities. So it could be a mobile healthcare unit as well. One of the questions that we did have was around your funding for the community health worker program. We still need a little clarity on that before we get to our funding of the folks who will apply. And so we were wondering if someone could maybe share a little bit more to us about how the community health care workers are accessing the dollars and what that process is. Is there maybe a staff person who could share that with us, or Commissioner Prizzier, are you aware?
Yeah, I can talk about it briefly. I think Claudia's here, but the health department is the one who's been helping to administer some of that along with Career Source, and neither of them are here. So currently, we allocated funding for a pilot of that program from American Rescue Plan dollars, well, revenue recovery dollars that were once American Rescue Plan dollars. And also, we have WIOA dollars from Career Source that support the program. So the idea is to, right now it's administered at the health department, and they do some of the data collection and partner with UF Health on the recruitment and training, or I should say the recruitment of employers and the training of community health workers. And we have a partnership with a community to recruit community health workers from the neighborhoods that are impacted, and then those individuals get trained and placed with folks that are with community-based clinics, with UF Health, with other organizations, and then they get those organizations, the individuals who are community health workers get paid for their training, and they also get paid for hours on the job at first to try to incentivize people to use more community health workers in their programming and sort of give them the chance to see if it works out in terms of the programmatic things before they roll it into their budget. So I don't know if that answers your question. But right now it's a pilot, and I think I think that they're supposed to be bringing back a presentation to us sometime soon, with regards to how the pilot's been going and recommendations for the future of the program.
Claudia's right there.
Yeah,
There she
I was
is.
gonna say, if Claudia
Yay.
would like to add any more to that conversation, that would be great.
God, somebody else like
Claudia Tuck, Director, Alachua County Community Support Services. Good afternoon. Commissioner, you summarized it pretty well. I don't know much more I can add other than there is not a sufficient fund to continue to pay a significant number of individuals. So if you were providing funding for the ongoing salaries, that would be beneficial because ours is really focused more on the training and the initial short-term period.
So I think what we will do, Claudia, is reach out to you all as this process continues. We plan to have the funding in our proposals within funding them, but I think we just need a little bit more clarity. Okay,
Happy to have staff work with you.
thank you.
Lee?
I'm sorry, yes.
Just briefly to my county commission colleagues, we had an extensive workshop in this area about how we could not replace, but actually add to dollars in the
Can you
community.
pull your microphone up a little bit?
Thank you. Add dollars into the community and really focus in on families, and having someone that was from the community really facilitate that because of this lack of trust that may exist. So, really happy with the trust kind of taking this on, and the RFP has it gone out or it's going out?
It went out like April, where's Christy? Here,
Like last month.
April 20. There we go.
May 30th.
Closes May 30th.
And how much, again, did we allocate in this for funding?
600,000.
600,000 to my colleagues, and
Okay.
one of the requirements is that the providers provide Medicaid, that they not provide Medicaid, and in line with what
That's great.
we've heard from other folks. So.
Thank you.
Oh yeah, you missed all that. No, were
I
you?
did miss all that.
Yeah, you did miss all that. Well,
But I'm glad
your voice was in your brain was in all.
I
of our hearts.
appreciate my voice having
Yes.
been there in absentia.
Any other questions from anyone? Well, thank you, Marcia, appreciate it.
Yes, sir.
Okay, the next item on the agenda is the comprehensive literacy plan update. Who do we have working on that?
And once again, we're going to
It's
turn
the
to
Marcia show,
our
poor thing.
wonderful executive director who is a wealth of knowledge about multiple topics.
Thank you, Mr. Chair. The BoCC met last week with our school board. So you heard a little bit of this, but for the trust board, I wanted to introduce our partners with the Lassinger Center. Pam Shalfut is here, and if I may, I'd like to bring her up and let her share a little bit of
Please.
what the plan is and what we're doing.
Good afternoon, and thank you for having me. I have a few slides to just so that you can get a visual of our overall goals, the project timeline, and the work that we have agreed to complete. We're very excited to be partnering with the Children's Trust to conduct this comprehensive needs assessment. So. While we're getting the slides up, I can just go ahead.
And it's in their packet.
Okay,
And everybody.
awesome. So.
Ms. Chalfant, before
Yes.
you get into it,
Yes.
as we've been going through this, and I know that the people on the Children's Trust are sick and tired of hearing this, but we've talked about literacy, but also I would hope that it would also have some sort of component that it's not just confined necessarily to literacy, but math as well, because there's both, when you're behind a little bit in literacy, you're behind in math as well. So if you could, that would be great.
You're absolutely right about that. This needs assessment is focused on literacy.
Okay.
Yes. But literacy should help, increased literacy, as you said, should help improve math as well. they're all interconnected. So our broad project goals for this needs assessment is to first organize existing information and then gather new information about what's currently being done in the county to support literacy. And then to develop a literacy plan that promotes literacy outcomes across all ages in Alachua County. Okay, no problem. So the overall project timeline is really from May. The contract was fully executed on Friday, May 3rd. So our timeline is from May through August. And that includes our initial launch, the 3 phases, which I'll go through, and then the final report presentation. So the initial launch, we met twice in April, and our target audience being the organization, district leaders, and the Comprehensive Literacy Planning Committee. We had our initial meeting with the Children's Trust on April 2nd, and then we met with the Comprehensive Literacy Planning Committee, we'll call CLPC for short, so that I don't have to say that 5 times, on the 15th of April. So we've had our launch, and the purpose of that meeting was that everybody be on the same page, that we understand what our goals are, and to start digging in and gathering those existing data. And now we have moved into phase 1. We conducted one-on-one meetings last week with our partners. So we've met with many people already, and we're just asking for whatever specific data they might already have. We know that different organizations have annual reports. They may have existing data on tutoring or other services that are happening in Alachua County. So we're just hitting the ground running and looking for those existing data. Again, we're collecting from the different organizations, community members, any publicly available data, and then we'll review those data, look at where those gaps are, and then that will bring us into phase 2, which is to collect new data. All right. And there's our phase 2, magically appearing. Again, listing our target audience, and then the activities will be the monthly meetings with committee members. We're going to gather quite a bit of data from the school district, and we've already spoken with them about gathering those data. We're hoping to get into schools and actually do some visits with teachers, observing in classrooms, conducting focus groups, and then we would like to administer a very broad survey to teachers, families, parents, and members of the community. So that will be our phase 2. And that timeline is, it's all right, timeline June and July, I have it memorized. And then phase 3 will be our post-assessment, where we will take all of those data, pre-existing, the data that we've gathered, and then start to think about what those data tell us about what the needs are and what our plan should be. And again, we'll do the initial sorting and organizing of those data, bring them before the committee. Everyone will have input on you know, the interpretation of those data, and then we'll put a plan together. The committee will review the plan, and then we'll create our final plan.
Commissioner Brazil.
Yeah, just a couple quick questions. One is, there was some talk at the last meeting around the K-3 focus. Can you talk about that and sort of that versus the comprehensive, and like just to be clear that we're doing this across the board from K through adult and not the K-3?
The plan will be for across the board, yes.
Okay.
You know, we'll look at early learning. We'll look at those data particular to 3rd grade and reading on grade level, but we'll also look at some of the data in other levels. And we're planning to have a meeting just to clear that up and make sure that everybody is on the same page we want to make sure and look at that scope of work and make sure that we're doing this work according to the scope.
Okay, and then my other question is, I guess, in regards to the school, like, review, I guess that maybe this is a question more for our school board member than, but possibly also you. It said May, June, and that's like, they're done with testing, they're almost out of school. Like, I'm just not sure how much learning and how much, like, assessment you're really gonna be able to do of, like, actual curriculum and learning, because they've already kind of finished out the school year by that point. So I'm
That's-
wondering how that's gonna go.
That's a really good point, and we are considering that. Do you want to speak to that? Okay.
Thank you. Actually, the Lassinger folks met with the school district on Friday,
Okay.
and they talked about that, and that is a concern. So what we're going to do is we're going to meet, talk about whether or not we need to expand and extend.
Okay.
Our goal was to have some kind of a report together so we could bring it back to everybody in August. That just may not be
able to be
what happens because we got started on this in April. So you all may receive an update that we have to extend a little bit into the fall. The key here is not to go fast. The key here is to do it right and do it right the first time. So more information to come, but literally at the beginning of the meeting, Pam was sharing with me what was discussed on Friday at the meeting with the school board folks, because they're doing individualized
Right.
meetings with the various partners.
Okay, thank you.
Thank you. So I am a little concerned about the response I just got right now, because I think any comprehensive plan has to go beyond grade 3. We know we have a serious issue with students not being on grade level by grade 3, but I don't think it's wise of us to invest the amount of money that we're investing if all you're going to come back and tell us is what we can do by grade 3, because we have a situation of students who have gotten past grade 3 and they're virtually almost illiterate, right? And we have to develop a plan to counteract that. And if you're telling us all you're going to be doing is grade 3, I think right now we need to be looking at an exit strategy or changing our scope of work. So I'm hoping that is not what you meant when you said, but that's what I interpreted. Almost, I was like, wait.
No, I think
So that is not what she meant. That is not what we're doing. Let me be very clear so that everybody understands. That is not what we're doing. You all were very, very clear last year, almost a year ago, to this meeting, that the goal was a comprehensive literacy plan from 0 to at least 18. But really, we talked about the families, because we said if the children can't read, sometimes the parents can't read, and we needed to have a plan. So our overall plan will encompass all of those folks, right? Where with Lassinger, when they came in, we were telling them that this got started from a discussion of third grade reading levels and third grade reading scores. So we will clarify so that everybody's on the same page, but how can I say this? The assessment will encompass 0 to at least 18. Additionally, our partners, our community partners, their focus is on the family. And part of the reason we brought in the library is because the library has a focus on families. We are adding Santa Fe Community College to this because we want to incorporate adult education. So I want to assure you all that that is the case, if I may.
You good? Dr. Hart? And Chair.
Hi, I'm aware that every once in a while the state changes the way they count stuff. But I'm really interested in trended data going back. Well, you know what I mean? Like, it could be an apple and an orange, but you're smart enough to explain to us how it's different and how we can look at old data trended over time to the current data that you're about to collect from people who have it in their reports or whatever the state is producing data-wise. I'm really interested in dog legs. Like, what policy changed or what happened? I know COVID is going to be a dog leg, perhaps, but what are we doing over time that is taking children off this trajectory of learning to read? And can we fix that?
we can certainly consider that.
Chair offers.
Many, many years ago, I worked in the neonatal intensive care unit at Shands when the first rounds of what they called crack babies came through, and those babies were removed from their parents. And a lot of those babies ended up having learning difficulties, and they are now the grandparents and parents of the kids that we're dealing with. And so this is a multi-generational concern. And we can't go back and fix the past, but one of the things that I am real concerned about is the identification of pregnant women who cannot read. And I'm hoping, and I know I've mentioned this before, but I'm hoping that one of your partners is UF Health or Shands in some way, or somebody that can help identify those women so that we can start them down the process of literacy, so that they can at least read the back of the Tylenol bottle by the time they have a baby, and they can practice reading with children's books, and maybe instead of 0 to 3, we're looking at a negative number, because I think this is I just think this is so critical, and when you talk about going back to those root causes and breaking that cycle, I think that this is where it happens, in my mind, just from my old involvement in healthcare, but my newer involvement in healthcare policy. So those were my questions: is if any of our partners are medical partners, and then. Also, just a comment, we met with the school board last week, and I was a little disconcerted by a discussion of a separate facility to deal with behavioral needs of children, when I really think that, I don't know if you guys are meeting with the school board, but since so many behavioral needs are linked to learning deficiencies, if maybe what we do need is a separate facility for children that can focus on bringing kids back up to grade level with, the special attention and funding and things that could go towards them to bring them back into grade level versus just focusing on behavioral problems. Just a thought I wanted to throw out there while we're having the discussion.
Okay, Member Labarge.
Yeah, I wanted to go back to something Dr. Hart brought up, which is going back in the data, because I think that one of the things that is important for us to know, we know that if you're not reading by 3rd grade, bad things happen down the road. I'd be interested to see if we can figure out where that really starts to fall out. So at what point does that child drop out so we don't even have their reading data anymore? And I don't know if the data you're going to get is so de-identified that you can't go back to that. But I think that that will give us a window of intervention time. That is the most opportune. We know we have to get them reading by 3rd, but if they're already past 3rd, when do we want to be really intensive, because we know we can really go back and change that? I think windows of opportunity depend on when we start to lose things. So again, I don't know if the data will allow for that, but I think it's related to your issue of, yeah, they measure things differently every other year, but can we get to something that helps us understand that?
Okay, Member Sir.
Thank you, Chair Pinkerson. I want to kind of loop back to something that Chair Alford said, and has been said. So I don't like that term when we refer to people, the situations that they're in, like the crack babies, the crack epidemic. So
I don't like it either.
So I think so please, could we be really sensitive in how we refer to that, to our fellow citizens and their children now who were impacted negatively by the drug epidemic that overtook so many communities. That's my first thing. Well, I'm going to pivot from there because I don't want to get bogged down in that, because I'm gonna trust that you didn't mean it in a real negative way. But I do want to go back to something Dr. Hart mentioned, Dr. Lombardo, and then you. So I asked Marcia if she would, if the trust could host a screening called The Right to Read, meaning that literacy is this day's civil
Right.
right struck, okay? And I think some negative things came out of that, there's, right, but, but in our county, before COVID, there was this huge disparity in learning. And as far as I can tell, and from my time on the board as well, is kind of confirming that. So a lot of things, it's a complex issue, but standards-based instruction, I mean, good, solid instructions on phonics is really key. Good support of the teachers by a school leader, a principal, and professional development. And if we were to go and look in the schools in our county, in Alachua County, where we have the children, the largest number of children who are not reading on grade level, you will find there are environments where there is very high teacher turnover. They have the most teachers that are alternatively certified, meaning that they didn't go through an educator prep program. There's been a churn in leadership, and they just haven't gotten taught, right? Some of the teachers, they're doing the best they can do. This isn't the bash teachers. Some of them are in there, they're doing the best they can do. So I think that's why I was so hopeful when our district adopted UFly, because it gave a framework to teachers, right? But they needed support. We couldn't just say we're gonna adopt this and then not support the teachers. So we haven't had a person, a UFly coordinator, for some time now. So I think, like that's where we start for the children that are K through 2, because that's what that program is. And we have one school who is trying to expand that. They're trying to hire their own, they have the person on staff, they want to get trained by UF to do that, but to change the trajectory. So I don't want us to get into victim blaming and blaming the children, because the kids who we want to address and we want to change and make sure they're on grade level by grade 3, they need our school district, and I'm not saying anything to y'all that I haven't said to my superintendent and to my colleagues. They need our school district to be the best it can be for them, and it's not. It's not. Our school district has failed those kids, because if you go and look at the data, like what I just told you, and I'm not an educator. You can probably, Miss Pam, Dr. Pam, you could probably confirm what I just said. I just know from me reading, they told us we gotta provide good instruction. If you're not teaching the kids something, you can't be, the state assessment is the state assessment, and they're not performing well. So there are children who may come out of homes with a lot of trauma. There may be some substance abuse and all of that stuff. But when they get there, I tell people, children are poor, that live in poverty, they're poor. They got a brain, and they can learn. I was a child who grew up in poverty, and I went to school, and I got good instruction, and I learned. So so I've said all of that to say, like, when we're doing this, we want to have community buy-in, and we want people to know that we're coming at this because we want them to learn, and we want to be able to change their trajectory, because we know that if they learn how to read and they can do math proficiently, that there's so many doors that are open to them. But we want them to accept what we are, so we want to be really cognizant of how we characterize the challenge that we are. And I heard that crack baby thing last week in the meeting. I heard it today, so I just had to say that. I'm sorry.
No, that's okay. Can I respond to that real quick? And I really apologize for using it in that term, but it was, as I said, that was a term that was used at the time, and it was abused by our state and used to remove children from homes, and I saw the effects, and it was horrifying. And so I'm sorry, I wasn't trying to say that to characterize anything, and you were right, it's the wrong term to use, but it was just such a terrible, terrible time to watch that happen. And to see that, and I feel like we're seeing, the results of these families that weren't given the help that they needed at that time. I feel like we're seeing some of the results of that now, and it just really, it's
we have
it's
some
hard to
systemic
me.
issues.
A lot of systemic
Right.
issues.
Systemic societal issues.
Yes.
That were sown before
Yes.
the crack cocaine
Oh,
epidemic, right?
absolutely.
And just like COVID,
Yeah.
COVID revealed a lot of things that were not that were not right, and that were advantaged some and disadvantaged some, or that provided an open gateway. So we got to fix the lake.
I agree.
We got to fix the lake. What we're seeing and the children not being able to read, this is also correlated to some other things, how housing is so segregated, so our schools are so segregated,
Exactly.
how there's food deserts, there's a lot of things, right?
All of those.
I'm sorry, our agenda's
Yeah.
long, so let's
Yeah,
not.
we're
I'm sorry, Chair Pinkerton.
We are both on the same page.
No,
I
what
think.
you said needed to be
Yeah.
said.
Yeah, I was gonna
and
say.
heard.
No, I
That's
agree.
what we're saying.
Okay.
And I
Commissioner-
hear. So thank
Commissioner
you.
Prizia first.
I just first want to say thank you,
Yeah.
sir, for being such an amazing leader on our school board. I love people who can speak truth to power, and this conversation around literacy is such a long time overdue, and I appreciated you supporting the idea of the comprehensive literacy assessment and all of you who supported us moving forward with it, and I'm excited about what the possibilities are. I do think that, your point about involving the healthcare industry is probably important, but I think it circles back to the conversation about community health workers. I think a lot of this is going to be about taking this out into the community where these people live and really understanding what those issues are at the grassroots level. And I think those community health workers, that's what their job is. That's what they do every day. And so they're a great conduit to start having those conversations with families about what those needs are, about where the gaps are, and particularly around, pregnancy and women. Actually, UF Health, one of the OBGYN faculty and clinicians is actually going to be hiring some CHWs and is also working on some community doula type programming, Dr. Adutola. So she would be a great partner. Awesome. Yeah, so she would be a great partner, but I just wanted to reiterate, the community health worker program, we sort of put it in this one space that was about health care, but really the idea is social determinants of health, and then being able to connect the dots for people and to bring the resources where they're most needed. And that will dovetail into our next agenda item as well. So I just wanted to bring that up and say thank you for thinking comprehensively about this and helping lead this in a way that's going to hopefully bring in the community as well as all the institutional partners, because I think that's really, really important. We have to have that community buy-in or we're not going to get where we need to go. Thank you.
Commissioner Wheeler?
Oh, thank you. Yes, thank you. To your question about where these things, where we started seeing some changes, my concern has been for the testing that we're seeing change from year to year. And because we're using Florida standards, I would really like to see a compare and contrast between what we would get from assessments using the CAT, the California assessment, or something that is more nationally normed.
I know.
A national test compared to what our state is, just for information, if you're collecting data. Because we used to use those assessments in another life. And I would really like to see, because we are changing so much from year to year, the teachers are having a hard time keeping up. And I remember testing at a time where we couldn't see the test. If you looked at the test as a teacher, you could go to jail. I mean, I don't know if you all remember those times or not, but I know I spent an afternoon going through the dumpster looking for a test that I'm notorious for that at Westwood now. I went through a dumpster looking for a test that I had inadvertently thrown away. And so I just, and you fly the other.
Did you find it?
I did. Oh, heck yeah. I didn't go back in without that thing.
Had to know.
No, I did. I found it. And Anna, you were saying the other day about the U-Fly. It's not a program that I know, but I was at one of the elementary schools where I learned that a lot of the teachers did not get trained in that. And so you were right, that they didn't have the preparation they needed to use that material. And with the, teachers coming and going, in and out of the classroom, I'm really excited to know that you all are going into the classrooms, but I would hope that you would talk to the teachers, particularly the third grade teachers, because the assessment materials that I saw last week, I was at Metcalf and then I was at Stephen Foster, and they are way out of line for the grade level. They are not appropriate for the grade level. When you've got children who can't even write their name, and then they are expected to read paragraph after paragraph after paragraph and then compare and contrast and do it on the computer.
Commissioner Wheeler, that's Florida DOE. That is not a local decision. The assessment,
I know, but
and when they have the input, we can give input, but they still.
Well, that's what I mean about state as opposed to national. I would like to see, if we are so far out of line, with what's happening else in the country as well, or we're so far out of line as to what we used to do that was effective, that was more effective. I don't know. I don't know, but I do know that the assessments that are being used right now for the 3rd grade, I showed them to my son who's teaching 6th grade at Lincoln, and he said, my 6th graders couldn't do it. So y'all got your work cut out for you if you're going into the classrooms. Please get the teachers to show you the materials and look at their faces when they're telling you the total dismay. And that there's that's one of the reasons everybody, that there are a lot of people leaving, a lot of teachers, good teachers leaving.
Do you conclude?
Yes, I
Commissioner?
do now. Thank you.
Dumpster diver?
I'm your girl. I was an art teacher too, so that was another reason to be dumpster diving, yeah.
I'm sure. I want to go back to the lake a minute because, and also to the cocaine epidemic results. The research years after that kind of disproved a lot of that about that being a biological basis for some of that. So short of fetal alcohol syndrome, which
That's another one, right.
is well established as having directly causing brain issues. The research on the cocaine per se was not the issue. It was the lake these kids ended up living in.
Right.
It was the removals, it was the poverty, it was all of the social determinants that we know, much more than the drug itself, right? So it was one of those cure worse than disease situations. And so I just wanted to say, let's not make assumptions about these babies because, in fact, they had the potential.
Well, that was my point.
Right. But so all of that got debunked research-wise later.
Okay, commissioner or member, whatever you choose to be.
It gets to be both,
Whatever.
because I marry Lubankian, so.
What a
convenient thing to have.
Well, we can, just keep calling me, that's all I ask. I just want to real quickly reiterate Commissioner Wheeler, what she's been talking about with regards to the teachers really have many of the answers. I've been in some of the classrooms and listening and watching them move kids along at the pace based on the techniques that they've been taught. Really lean in and ask them, because I think many of the answers are there in the classroom. Mr. Chair.
Yes, ma'am.
I'm just
Member,
Mary.
Member Mary. Mary Chance.
Thank you. To Member Certain point and to some of the other discussion and things that are really hard and social determinants to figure out, one piece of data I'm sure you're going to look at is school attendance. Chair Certain said when they get there they can learn. Yes. There's the workforce issues, there's the teacher development, but it's the if they get there, and that is a nationwide huge problem, particularly post-COVID, school attendance. And we can get that data and get our arms around it and look for linkage.
But may I add, just busing is an issue. We have a lot of children that are left on the side of the road too and can't get there. And that's another good point for having community schools where kids can walk to school. But that's, busing has been a real issue, and particularly in the outlying areas.
Which is probably also related to workforce and.
Right.
And actually, we've been given that information about the attendance.
Yeah, I'm sure you've got it linked in the.
Yes, Executive Director Conner.
Thank you, everybody, for your input, and we will take all of this information as we continue to gather data. I do want to say thank you to Lassinger. Like I said, they came on board here in the final hour and saved us. And this portion of our plan is our needs assessment. So I want to be clear that that's all this piece is the needs assessment, the gathering of data. And then we will come back to you with that report, and then we begin the plan. Okay?
Take the whole community.
Yeah. But so I just wanted to make sure that I stated that. But thank you for everything you're doing for us. Thank you, everybody.
Thank you.
And thank you all. And can I just say that, like, the passion around this issue is inspiring. It really is. I mean, the discussions that you all have and the discussions that we're having with our partners when we're meeting with them one-on-one, I mean, it's, we will come up with something to put in place, something systematic that will hopefully make some changes.
Madam Chair, there was no motion, however, I guess we should ask if anybody from the public would like to address this particular issue.
I'm good with that.
Okay. So if anybody would like to come up about the.
Any public comment?
Yeah.
And if we do have public comment, if we can limit each public comment to about 3 minutes, that would be great. But,
That mic over there.
yep, the mic down at the end of the table if you would like to speak.
Can you take it?
Looks like we have a couple.
Good afternoon.
That one, there you go.
I heard all the discussion about learning and this and that and forth. Everything that everybody said is correct. It's for me as a parent and my kids going to Westwood before he died, he dealt with reading issues. So I understand what you were saying as a teacher. I don't know if you knew Christopher Scott, and I also have a 12-year-old. He dealt with reading issues, but I was never on drugs. You know, it's they had a program. I think it's the STEM program at the Terwilliger, where the UF students come in and help the kids read. His grades went up from D's, C's, D's, and F's. My son made A's and B's now, and I'm so proud of him. With just 6 weeks of me getting him to school for like 4 months every day. And over the summer at Terwilliger, this was last year, a year before last, they had the STEM program, right? I think that's the name of it. But it works. If we could get that program in each elementary school, from kindergarten, these kids will learn to read, but they got to get to school.
That was that.
That's an awesome program. Awesome. So I just had to speak on that as a parent to let y'all know. Good job, teachers, the ones that, you know, that's actually in class and, trying to make it. But it's also hard for kids to learn when there are behavior issues in the class. I saw some stuff
Can you
on my phone.
Can you give us your name for the record?
My name is Stephanie Scott.
Stephanie.
Yes,
Scott.
yes,
Thank
ma'am.
you, ma'am.
Thank you, Ms. Scott.
Mhm.
Appreciate it very much.
But yeah, if we could get that program with the UF students in all the schools, awesome.
That was a youth line.
Awesome.
Thank you.
It was part of that America Reads thing too that we tried to fund it.
Would anybody else like to come and address? Okay, all right. The next item, I believe.
Yep.
Madam Chair, Joe.
I believe so. So item number 3 on the agenda is our gun violence update, and we're going to turn to Alachua County staff for this one.
We have the presentation.
Oh, did you want to make some public comments? Okay, all right.
He's the proposal that you guys put on.
Good afternoon, Madam Chair and Mr. Chair, Children's Trust. Good to be, it's an honor to be before you again today. I think that I can give you an update on where the county is with the gun violence prevention, and then maybe I can step aside and allow our new gun violence prevention manager to come and provide an update. And I think maybe you're going to hear also from a grassroots organization from the neighborhood to talk about gun violence prevention. So there is a lot of activity going on right now, and in reference to gun violence prevention, which is good. We need that energy. We need that uptick in prevention strategies and all. I can tell you that from the county standpoint, the county has, of course, passed a resolution last year that mirrors the resolution of the city of Gainesville, and also has approved and signed, the chair has signed a memorandum of understanding that forms a partnership between the county, the city of Gainesville, and Santa Fe College to work together to develop strategies to address the issues concerning gun violence prevention. At our last meeting, we agreed our next meeting is to come up with a budget for it. The county has appropriated, the city appropriated $150,000. The county has matched that, has put up $150,000, and we'll be looking at additional funding in the budget process coming up. So we'll be talking about where we need to provide other funding that will support strategies to deal with gun violence prevention. At our last meeting of the partnership with the City of Gainesville and Santa Fe College, we agreed to, at our next meeting, to look at budget. Also to form we've mentioned forming a group that would be a diverse group of representatives from all over our community and different parts of our community that will come together and develop strategies and develop the plan for going forward. The City of Gainesville at its meeting last Thursday presented a plan called Impact, adding additional resources to gun violence prevention. And you'll hear from Brittany Coleman, the gun violence prevention manager. We'll talk more about that. But adding the BOLD program, which is a program that really focuses on youth up to the age of 24. And they also provide interrupters, and interrupters are those persons who go into the neighborhood and actually help to curtail, if you will, violence in the neighborhoods. And so we're certainly interested in that. We've also had conversation with leaders of what do you call it, CHW, Community Health Workers Program, and looking at the possibility of community health workers also being involved in nonviolence, in gun violence prevention. So we're ready to get things going, and we're certainly committed to working alongside not only the City of Gainesville, Santa Fe College, but also grassroots organization. NAACP, the Youth Council, has already indicated willingness to work together, and other nonprofit organizations. We are 24/7 with our crisis center and our victim services, and we're bringing all of those services to the table to help deal with gun violence prevention. But like I said, I'll yield my time, the rest of my time, to the gun violence prevention manager. We're excited to have her on board. She was a former counselor with our victim services division, and we were glad to be a part of bringing her aboard with the City of Gainesville. Excited to have her here and let her provide an update on the rest of the program. And like I said, I think you'll be hearing from a grassroots organization also. We heard a dynamic presentation from the Cease Violence in the Hood organization last Thursday at the Black on Black Crime Task Force. And I think you're going to hear some of that today too. So we're excited to have them here today.
Thank you. Good afternoon, Madam Chair, Mr.
Can you
Chair.
pull that a little closer? There you go. Just give it a good yank. There you go.
I bet you AV guys loved hearing you say, give it a good yank.
Good afternoon, can you hear me?
That's better, thank you.
Yes, my name is Brittany Coleman. I'm the new Gun Violence Intervention Program Manager with the City of Gainesville. Madam Chair, Mr. Chair, we're really happy to be here. If you were at the City Commission meeting last week or tuned in, you'll have seen this presentation. But these are just some of the city's efforts as we move towards our comprehensive ideas around gun violence intervention and prevention. And I'll try to move through this. I know we have another really exciting presentation of gun violence interrupter program after this one, so I'm excited for you all to hear that one as well. So this just gives a little bit of background as to how we got here. You all might be very familiar with this, but last year in 2023, the city and the county both made gun violence a local public health, named it as a local public health crisis. And these are just some numbers from GPD as to why it was really important to do that. So we ended the year 2023 with 14 homicides, with 16 victims in those 14 incidents, 13 of which were killed by gunfire. 60 people were shot or injured by gunfire, and there were 147 reports of shots fired. Which moves us to earlier this year, Mr. Smart mentioned the allocation of $150,000 from the city and also from the county as well. In March, on March 11th, I came on as the Gun Violence Intervention Program Manager, and in the month of April, we really prioritized community engagement and outreach. And so I think ended the month at attending about 24 different community engagement opportunities, including two gun violence town halls, one sponsored by Florida for All and the other by Moms Demand Action. So a lot of really good opportunities to hear or get community feedback and to hear from our stakeholders. So as we think about the tenets of the efforts that we've all put in so far, like I mentioned, the month of April was about connecting with community organizations, also providing trauma-informed outreach, which I'll get to a little bit later with our community care callouts, collaborating with our partners, our faith-based organizations, our law enforcement partners, and some outreach providers as well, developing a culturally sensitive community-based solution, and focusing on young people and those with lived experiences. Those were some themes that came out of the community engagement that was done, not just in the month of April, but over the last year and a half, 2 years, led by a lot of our stakeholders and our city commission as well. There have been a lot of opportunities, and people have come to those opportunities and said what they wanted. And so this plan looks to incorporate some of the things that we've heard. And so, as Mr. Smart mentioned, we've created a framework that we want to use moving forward as we develop programming and plans around gun violence intervention and prevention, and that is Impact GMV. And so that was developed by listening to the feedback that the community gave, as well as using the DOJ's 10 essential actions for violent crime reduction and the CDC's social ecological model, which looks at intervention at multiple levels. And you'll see there individual, relationship, community, and societal, which is looking at policy change, which is some of the things that you all have been talking about all meeting. And so Impact GMV, it looks to improve access to mental health services, social supports, and the arts. It looks to mobilize and enhance existing community-based services and groups. And I want to pause here as well, because another thing that we heard in these themes from the community and from stakeholders is that they don't necessarily want us to reinvent the wheel. There are community-led agencies, nonprofits, organizations that are doing good work. And so how can we as an entity come alongside these organizations and help the work that they're already doing? As well as, excuse me, understanding how the impact of gun violence plays into the overall health and wellness of our families and of our communities. The third point is prioritizing public health and safety in areas most impacted by gun violence, analyzing gun violence data, and I want to emphasize here that yes, that is data related to shootings and homicides and things of that nature, but we also want to look at sustainability for our programs, and you all might be familiar with One Nation, One Project, which is a national project that we also have a local stake in here, which is doing programming related to gun violence awareness and incorporating the arts. And so we're in phase 2 of One Nation, One Project, and we're in the data collection phase of that project as well, looking at how to sustain those programs, what has an impact, what's working, and all of the projects so far have been extremely successful. But when we look at sustainability, it's about looking at the data and what we can sustain. And then also, again, centering youth and tracking our progress so that we can celebrate our successes, but also look at what's working. What do we need to adjust? How do we incorporate feedback from the community? And so that is the framework for Impact GMV that we are using as our guidepost forward. And these are just some examples of efforts that are currently underway. June is Gun Violence Awareness Month, and so we're looking at how to engage, again, agencies and organizations that are going to already be doing events and things during the month of June. How can we support them? Also developing a gun violence awareness campaign and a social media campaign, leveraging social media to get messaging out. We're looking at potential grant funding opportunities with, of course, with our law enforcement partners, but also as the city, what can we use to sustain these efforts past the current funding? Mr. Smart talked about the Alliance. We're really excited to get that off the ground. We have had meetings about the structure of the alliance, but also, which is really important to note, transparency and how we are going to create a structure and a framework for people to, for people in the community to be engaged in the alliance, and how we create transparency and feedback loops has also been a part of that conversation. So we've been hosting or looking to start hosting crisis intervention and de-escalation workshops in partnership with the Alachua County Crisis Center, and the directors here as well. And we're really excited about this. I think another thing that the community has talked about is the importance of knowing how to support people who are in distress. What do we say when people come to us, our friends, our families, our classmates, and they've experienced gun violence? How do we support them? And so this will be, and I hate to put Ms. Martinez on the spot, but this is also an abbreviated version of crisis intervention training that our law enforcement officers receive and other people in the community who say they want that. And it's tangible information on how to support people through active listening, listening to understand and not respond, how to be open and non-judgmental in your response. So really tangible things that people can take from these trainings. And it is based out of working directly with community members and not necessarily law enforcement for this iteration. And then, as Mr. Smart mentioned, we're looking to expand staffing by bringing on partnerships with a few new entities, and BOLD is the first that he mentioned, Brave Overt Leaders of Distinction. And so the BOLD program has been placed by the city manager under or on special assignment under Chief Joe Dixon to help us in our gun violence intervention efforts. He mentioned that they do work with young men up to 24, but I think they've expanded to work with all people. And a lot of times the folks that they engage with have experience related to gun violence, are justice involved. And so we're looking forward to them bringing that expertise to this work. They're also going to partner with existing programs such as our community resource paramedicine program that does provide some ongoing case management, connection to health resources, social services, housing, and things like that. And then the community-led part of this, and I do want to say that this is very new and exciting. It's also still being developed. We're still working on this, and I know you're going to hear another proposal about this that we're excited about as well. But we know the importance of bringing on community-based organizations that are separate from government entities or law enforcement to build that trust and collaboration with the community. And so the Willie Mae Stokes Community Center has been contacted about helping to be a partner in those efforts. And that's directed by Bishop Christopher Stokes and has been in existence since 2018, but Bishop Stokes has been a member of this community for decades, providing services to the community. And also just helping us create this framework. And so they're going to be focused on the community level work, community outreach and engagement, focusing on schools, after school programs, churches, and working with folks who have lived experience related to gun violence with the purpose of disrupting cycles of violence. If they get information about things happening, how can they be in those areas to help provide some disruption? And again, that's still being imagined and worked through, but the focus is to help us have a community-led arm of this work. And these are just some other examples of Impact GMV, the community care call-outs. I think there have been 3 so far that started prior to me starting, but the heart of the community care call-out is for a group of stakeholders to go into communities after a shooting has happened. Traditionally, they've been led by the police department, with the crisis center, with Alachua County Victim Services, with our community resource paramedicine program, and they go door to door in a community that's recently been impacted by gun violence, offering services, real-time referrals to information. And so the last meeting that we had, and I'll definitely let Mr. Smart
Yeah, I was just going to say an example of that with the Sweetwater Square shooting, Lincoln Estates shooting, and some of the incidents of violence in the Pine Ridge neighborhood, but several neighborhoods where some of those things have occurred, and having the community call out the counselors to go into the areas along with other stakeholders lets the folk know that there are resources. If they have needs, they can let them know what those needs are, and we can address those needs as a partner, city and county working together.
And I think something to note too, the last community care call out that was done was initiated by a neighborhood watch coordinator, where she contacted us and said, hey, we need some services here. And so a community care call out was initiated, but it was started by the community saying we want this. And then One Nation, One Project, which I mentioned here, just a couple of examples of some recent events that have happened or will happen. On last weekend on the 27th, the city hosted a career influencer showcase in the arts and culture space. And so we had entrepreneurs, business owners in arts and culture come to the Blount Center and engage youth around what they do, offer volunteer or internship opportunities, and a lot of them had hands-on things that the kids could engage with right then and there to see if it's something that they would be interested in. So that was really successful, and we look to continue to grow that. And then on the 27th of July, we are participating in a national community culminating event, if you will, of One Nation, One Project. All of the sites across the nation are going to be doing events on this day to engage the community around their specific project. Ours is gun violence awareness, and so on the 27th, we'll be having our event that's being directed by Mr. Marion Caffey, and more information will come out about that. Oh, these are just pictures from the career showcase from the One Nation, One Project Youth Advisory Council, made up of youth in the community who have lived experience, who know folks that have been impacted by gun violence, and they've been giving recommendations as to what they want to see moving forward as well. So this is just pictures of folks engaging in some of the different projects that were there that day. And then here are just some examples of how the city has partnered with some local agencies. The Mirror Image Leadership Academy Gala, they work primarily with African American students, providing travel opportunities, mentorship, case management. And their first cohort of scholars graduate from the program this month, and they're having their gala to celebrate them on the 16th. People Against Violent Enterprises, or PAVE, they do their yearly gun violence awareness event, which is a backpack drive as well. I think over the years they've given away over 50,000 backpacks. They look to give away about 5,000 this year, and so the city supports those efforts as well. And then finally, A Class of Her Own, which is a documentary film screening by a legendary Duval Elementary teacher, Miss Gloria Jean, who you all might be familiar with, but she used very innovative ways of teaching children by engaging them in hip hop, call and response. And so a documentary on her work has been done, and it's going to be premiered at the Aquin Jones Museum. And then these are just some examples of how our city leadership, our mayor, members of our city commission have engaged federal and state legislators and leaders around our efforts here locally to combat gun violence. And with that, I do want to say this is just the beginning of us developing our framework. It is still very much being worked through in hopes to be as collaborative as possible. And I see Chief Joe Dixon. I'll let you say anything you might want to add.
Certainly, thank you. Good afternoon, Commission, our neighbors, all the community builders. There's certainly a great deal. First, on behalf of Cynthia W. Curry, our city manager, Honorable Mayor Ward, and of course our commission, which we have Commissioner Duncan Walker here. Just want to acknowledge that a great deal of work has been done. Rightfully deemed a public health crisis, the city of Gainesville, of course, has been innovative in having a community health department, a community health arm, and we've meticulously worked and combed through data, research reports to make sure that we identify best practices and the countless efforts of our stakeholders that have gone into us to this point to make sure that we're continuously moving forward. We understand the urgency, but we also understand that the race is not given to the swift, and we're going to certainly look to endure to the end, plot a favorable course that allows us to have a favorable outcome. It's exciting to hear the energy that comes from the city and our stakeholders, the county, and all the other stakeholders that we have been working with, including the conversation that I've had with Pastor Duncan. The ceasefire model is a model that has been successful around the country, but there is no magic pill. But we're going to work to make sure that whatever it is that we do, I was present the other day, Deputy Manager Smart talked about the Black on Black Crime Task Force, and Mr. Jarrell Whitehead and the strong-minded youth team, which they're here tonight. His presentation was compelling. It's because of that lived experience, and he is the demographic that is most impacted, the demographic that is dying. You can't replace that when you have a messenger. And so we're looking to understand that the city is looking to, and we're willing to partner with all comers because we are stronger together, we are better together when we put our resources together. So that's what I want to end with, is that the city is together, and together. Thank you.
Thank you. Thank you all. Okay, do we have any questions for folks? I had one quick question while others are thinking about it. I was lucky enough to be able to attend the event where I guess it was the last One Nation, One Project. Yeah, the black box.
Who's in the box?
Who's in the
Who's
box?
in the box? That's what I'm trying to say. Who's in the box? That was an amazing thing to attend, and I was very impressed by the resources that went into that, especially the drawings for the kids where they got a little cash in their pocket and things like that. I know Pastor Stokes, and I was curious, how are we supporting efforts like that? How are we funding those things?
So that particular program was supported through One Nation, One Project. I believe they still have continued funding to put on 2 or 3 more productions. And so when I mentioned the sustainability piece, that is a part of what we're looking at, how to sustain. But that was a One Nation, One Project.
I saw that as being so incredibly effective. I've never seen so many engaged and interested kids, even before they knew they were going to get money in their pocket, potentially.
It was standing room only, and
I
they
saw
had an
that.
overflow, so it was widely successful.
It was just, and it was so inspiring to see. So that was an incredible effort, and I would just encourage any of y'all that haven't seen that to take, if you can get in without taking a seat from a kid that needs it, I would recommend trying to see it. It was just incredible. It's hard to even describe what it was, but sorry.
I was gonna, I think that we had asked the other folks to do a presentation, so I'm wondering if we should hear them and then open up for questions so that we can ask questions of
Oh, do we have
everybody
another
that's involved.
presentation?
Yeah.
Yes, okay, well, let's hear that too. Unless you guys have specific questions about this to these presenters.
I did just for Brittany.
Okay.
Just a
I did too,
suggestion,
but-
Brittany, just, you mentioned the crisis intervention, training that was done. One, and it just popped in my head, years ago, I attended like a mass CPR type thing. And I know you all are doing, I'm not sure what your delivery method is for your crisis intervention training, but I was just thinking of maybe doing like a quote unquote, like a mass training, like in the community where we just maybe one in the rural areas, one in east, northeast, southeast, one in the swag area. Like, do it where people could just come, students, you know, or maybe with the target to our young people, because some of this is they need to learn how to handle all those things that you were talking about that folks learn, you know, when they hear somebody that's in crisis or there's a disagreement and how to handle struggles. That was all.
It's a great idea, thank you.
Do you want to wait, Commissioner Cordes?
I'll wait.
Okay.
Yeah,
All
I'll
right,
wait.
let's bring up our other presenters. I'm sorry, I was under the impression that was the end. Yeah, or the last.
May I just make a comment?
Member Chance.
Thank you. Brittany said, I think she started like April 13th, and that didn't go missed by me. I mean, the level of productivity and what she just shared in the past 6 weeks is pretty phenomenal. And a couple of, and I was happy to see the arts involved, and, you know, other communities have done sculptures with reclaimed, you know, guns and weapons, or made gardening tools. I mean, there's so many things to do. And one last resource is the Public Interest Communications Department at UF is about messaging campaigns that are for moving social issues. Like, they've done them on health issues, on all sorts of things. So if you get a lot of information at some point and start thinking about how to message that, and it could be engaging them and students in their student-run agency, but it's a pretty solid department at UF that's pretty unique around the country.
What's it called again?
Public interest communications, so it's about communications for the public good. Rather than me trying to sell you a product, I'm trying to, and it's not about just raising awareness, it's about moving to action. So they've done specific things on lots of topics, but
They host the Frank conference here every year, and it's sort of like using mass marketing and traditional marketing tools, but using them for ideas and public campaigns as opposed to trying to sell a product or a service.
So I could give you examples, but some in public health have been pretty profound.
So are they in journalism, or where?
In the College of Journalism and Communications. It's a new center in the last, I don't know, how many years.
Ann Cristiano came on as the first endowed chair in like 2015, 18, something like that. Yeah, it's been, they've been around a while. It was pre-COVID, actually. It was before that, because I was Office of Sustainability, so it was 2015, somewhere in that neighborhood when she first came on.
She worked with Robert Wood Johnson Foundation on public health issues, and there's a lot there.
Yeah, it's a pretty amazing department.
Okay.
Good afternoon, how y'all doing?
Yeah. How are you?
I'm Jarrell Whitehead, Ms. Pinkin, and the head counselor. How y'all doing? To everybody else on the board, to the community. I'm Jarrell Whitehead with Strong Minded Mentoring, and I'm a partner with Pastor Gerard Duncan, Pleasant Street Civil Rights Coast Yard Center. We have brought some guests coming in from cross seas, all the way from Miami, some from Gainesville, all the way to Chicago, that we would like to came here to help support us with our gun violence. We do understand that gun violence right here in Gainesville is something that needs to bring with everybody on all sides. So I'm here today to share a proposal for a community-led program called Cease Violence in the Hood to address the gun violence crisis in our community. We heard everyone loud and clear at the last year's gun violence summit. And I mentioned in our proposal, along with recent speakers, with our community partners, the City of Gainesville, who has recently presented a similar interrupted program, as well as INSPIR, which is another interrupted program that was implemented by former police chiefs Tony Jones and Caleb Young, in addition to the work that the city, the county, CTAC, school board, and Santa Fe are all doing. I must stress this part, that Cease Violence in the Hood, with this collaborative that we're trying to do, we want to implement everybody from all sides. We need all partners to come together with us on this situation, because we do understand that the killing and the violence that's going on is something that we can't bring back, like Mr. Smart spoke about earlier. We do understand that in order to collaborate, that we need to build an effort of the program that addresses the challenges as its grassroots. Strong-minded Mentoring have teamed up with Pleasant Street Civil Rights Coast Yard Center to respond to all calls and combine our efforts in partnership with Curb Violence Global and our community partners to build connections with justice involvement youth to bring resources that address the social determination of health together to make a positive impact. Today, I have built a slide. Hopefully we can get the slide up. And it was off our roadmap, DOJ roadmap, from 2, 3, and 4.
Working on it.
Working on it. I understand.
Technical difficulties.
That's what all that scurrying around
Yeah.
you is.
Trying to find the presentation.
Need me to resend this?
Hold on one moment.
Yes, ma'am.
Why don't you mind introducing your,
The people that we have?
Yes,
Yes, ma'am. So when the people that,
One moment. Is it one of
I
these
hear that.
presentations?
He's the voice of the community.
sees violence and, no, sir. It was labeled sees violence in the hood.
Do you have it on a jump drive?
I can email it, send it to her, email if you need to. I sent it to her this email.
Is it? It's not this one. Who did you send it to?
While we doing that, I'd like to introduce our people from career violence, interrupters from Global. We have Dr. Where's she at? Dr. Williams, and we also have the person that is over it, one of the founders of it, Mr. Kobe Williams. Also came along with him is Chris Richardson, also Joaquin Noah, and Trent Richardson, and Trent Green.
Torian Green.
And Torian Green, I apologize. One of our former national championships, back-to-back champions from here from the University of Florida alumni.
Thank you for being here.
And with the Career Violence Interrupted program that they do have, from everything that we've been going so far, with strong-minded mentoring to cease violence in the hood, we do believe and have faith in their program. It has shown from the times and places where they have been at, coming together and unifying with them guys and seeing their program, that they have got results. And with me along with Mr. Pastor Duncan, we do feel that we do need that here to help save our youth, to help save our communities. Yes, ma'am.
So, Madam Chair, if this PowerPoint is critical, I would suggest that maybe we take 5.
How about we go to agenda item, another agenda item, and then come back. You can give us updates. I don't know how long 4 is, but
Get,
don't think 5.
we have
one
chair,
more.
Madam Chair.
What's that?
We've got
We have somebody to come.
Oh, okay. Yeah, please, come up. That'd be a fine time to take some extra public comment.
How y'all doing?
Doing great.
Good. So, Pastor Gerard Duncan, along with Mr. Whitehead here, we've been working together for some time, and I'm very proud of the work that he's been doing. First of all, I would like to say that my involvement with this project came from being asked to be a part of the committee that helped organize the last year's summit. And out of that, I was asked to bring to the summit justice involved individuals. And so I had been meeting with some justice involved individuals that I had known for some time, and Mr. Whitehead had been one of them. And so after I invited them to come to the meeting, they wanted to become involved. And so we started the Cease Violence in the Hood, which is a part of or from the ceasefire, which we established with the Gainesville Police Department and the pastors group. I would also like to mention that Ms. Cheryl Kaufman is here for Department of Corrections. She's Circuit Administrator. I would like to say this because this is very important. There is over 700 right now, 33 years and under youth who are actually on probation. And often as we see in our news and as often as we see a lot of the gun violence, it's mainly we're seeing those who are on probation. So what I'm saying now, there's over 700 offenders, high-risk offenders, who are involved or who have been involved. Having 733 and under, that's not even juveniles. in our community right now. And so we found the need to be able to come to a call of action. I will say this, as we are partnering with Cure Violence Global, we brought Cure Violence Global here to help our community. We didn't bring Cure Violence here just for Pleasure Street and Cease Violence in the Hood. We brought them here for our community. Our community is in need. And in recent, we had no idea that the city of Gainesville was presenting their presentation, but I've always been a partner with the city of Gainesville. Most recently, prior to Chief Scott leaving, I was his liaison. And my role was to work collaboratively within the city of Gainesville and the county to help come up with solutions to the gun violence. And out of that came our partnership with Ms. Kaufman. And I can tell you that we tried working with some of those 700, and it is a task. We know exactly who they are and where they are, and we need to put our efforts together. Recently, I've had conversation with Mr. John Alexander and Mr. Caleb Young, and we have decided that we're gonna present the date, but we wanna come back, and we wanna give you all a proposal that's not gonna divide our community, but it's gonna collaborate our community. And so as Mr. Whitehead is gonna share this information, and we have Cure Violence and some of the players gonna come, they're here. All of those players are here. They love Gainesville as much as we love Gainesville, and he was willing to come today to support us. But we want to come back to the drawing board, and we want to work together with Pastor Christos, which is a good friend of mine. I had no idea. I thought he wanted to do Who's in the Box, but it's all good, and we could come together. And so that's what we're going to do because we want to work together. We're stronger together. And so Mr. Whitehead is going to give his presentation, but we all are talking about coming together and bringing a plan to you all that we believe that will bring our community together. Thank you.
Thank you, Pastor Duncan. Well, it looks like we're ready for our presentation now.
Yes, ma'am. Appreciate
All
it.
right, thank you.
Cease Violence in the Hood.
It's moving.
All right. Yeah, it's about us, about Cease Violence in the Hood. So we'll move.
You may have to pause it.
Whoa, it's going fast.
Yeah. All right, our mission, to identify and support high-risk individuals and groups. How we plan on doing that? By going into the communities and establishing things that, from taking surveys and understanding what is the people that they said that they needed, the kids. Mostly targeting them by coming in with Cease Violence in the Hood. Some of the things that we do want to come in and establish inside the communities that we do know and hearing back from the communities. Communities like, for instance, like Mr. Smart has said, Majestic Oaks, Village Green, Gardenia, Sugar Hill, known as Woodland Park, and going inside these communities and talking to these people that stay there in the communities and allowing them to give us their feedback on what it is that they want from out of the communities. They tell us they want jobs, community centers, and also real role models inside of their community that they can actually relate to. Now, in the mix of doing that, how can we build a safe haven back for our kids again? Yeah, we do have community centers. We have things like this nature, but the kids are saying they can't relate to the people that's inside them communities that's running these centers. So we get there and have a people that's established by having them, holding them responsible, holding them accountable for what it is that some of the things that they have done when they're inside of their community, how to get them opportunity to feed back. Then I think we can have a positive outlook because that's what the kids is asking for. On this roadmap, it is showing us that the place here in Gainesville, now we all know the hot spots, we all know the areas and where crime is going in. And I say at a point now with Gainesville, where crime is everywhere. So we know violence is everywhere. So how can we attack and get there to the violence? How can we stop there and get there to stop the crime from happening? By allowing people who has been justice reinformed, people who just like me, who understand the individuals, who can go and knock on doors and they actually gonna listen. They gonna come in there and talk to me because I'm gonna speak their language. I look like them. I'm not gonna knock on the door and just get a blank person to sit and say, no, I don't wanna talk to you. No, I don't open my door, because they're not gonna feel threatened. In the mix of that, they understand that we do mean business because we're here in the community and we wanna see a change because we wanna see our kids make it home at night too. And if you're a parent like I'm a parent, then you understand where I'm coming from. So on the mix of doing this, like Pastor Gerard Duncan has said, we having a list from probation. Having this list from probation and what it allows us to do to help us identify who is committing these crimes, who might be a potential person at committing this crime. Being able to go there and establish a relationship with them in that neighborhood, from the neighborhood they claim they are from. So by us doing that, going in and establishing this type of network and stuff with them, now we're building the bond. We closing that gap. That's the distance between the community and law enforcement. And in the mix of that, we hoping that bring along with Cure Violence Global, that we'll come along and we'll have, if the link will play. They didn't. But on the side of that picture, you would have seen that kids have unified themselves, and they saying to themselves, cease violence in the hood. Because in actuality, nobody want this. Nobody want to go out there and want to have guns and tote around guns. Nobody want to go out there, but they want to see people that they don't feel threatened by. If I'd like to bring up some of the people from Career Violence Global to come in and come up and talk and explain their program a little more.
Yeah, I think it's different.
Good evening.
Kobe, sit here, sit wherever. Thank you.
Okay. Good afternoon.
Good afternoon.
My name is Dr. Monique Williams, and I am the CEO of Cure Violence Global. And really quickly up here with me is Kobe Williams. He is my Director of U.S. Programs, and then also someone obviously who does not need introduction. You all are very aware, Mr. Joakim Noah, who is an ambassador to the organization, but also an advocate for community violence intervention work. And so much so that, you know, post-MBA career is dedicating himself to violence intervention work. And we have some things happening in partnership with his organization and project known as One City that's happening in Chicago. And there has been some interest here in Gainesville around maybe engaging in that type of initiative along with the violence intervention component that we're working through right now. And so if there are any questions related to that, I wanted to make sure they were up here to be able to talk about those things. And so I was gonna just answer questions, but briefly, as it relates to, you know, who we are as CVG. You know, we are the pioneer organization who kind of brought to the forefront the idea of utilizing kind of epidemiologic reversal strategies to violence prevention efforts. So in the same way we've tackled things like cholera and tuberculosis and AIDS, those same approaches are being applied to violence. And as an organization, we've been doing that for the last 20 years. Most people know us as the organization that does interruption, right? Created what's known as the interrupter model. And though there are 3 core components to what we do, one of those main components is the interruption, the identifying, detecting, and interrupting the transmission of violence. Next to that, it is, you know, identifying those individuals who have been placed at highest risk for being violence perpetrators and or victims, and working with those organizations in ways that help to deal with their mindsets and behaviors as it relates to violence. And then that happens with, we call them outreach workers, but they operate very much so like community health workers. And so you guys were just talking about community health workers earlier, and they kind of deal with addressing those resource kinds of needs that sometimes are kind of the risk factors for violence for a lot of the folks in the community. And then kind of the last leg of the work is changing community norms. It's not enough to just deal with the individuals, right? A lot of us, we are products of our environments, and a lot of us, you make the choices that you have, right? And so it's not enough to just work with the individual or even the individual and their peers. It's the individuals within their community and the community context and the culture of that space and the norms of that space, right? And so it has to be a very loud, resounding sound that is unified, that violence is not normal, right? And so then it's not just the message that violence is not normal. How are we exposing and showing you that there are ways of being and ways of existing outside of that normal, to begin to be able to actually solidify kind of that norm change and mind change that we're dealing with for these individuals. And so, I mean, that's the program in a nutshell. We deal with health departments or mayor's offices or coalitions for violence prevention to help kind of build up the infrastructure necessary. I think, right, there's a lot that I don't have to say because a lot of it has been said. Everybody gets the collaborative nature of violence. You understand that it is multifaceted, it is multidisciplinary, and it requires everybody at the table. And so getting everybody at the table under kind of like that collective impact model way of thinking with kind of one frame, one agenda, one goal, and then building the strategy out around what that goal is. And for us, right, it's reducing shootings and killings, period. And while we are a part of the strategy, it is a very significant and important part of the strategy, because it's the part of the strategy that stops violence today, right? It's the stopping of the killing today. It's using whatever we train individuals in, that kind of persuasive engagement, to be able to like de-escalate situations when things are really heated in a moment that could have ended in someone's life being taken. But because of these kinds of strategies, right? Like you have another 24 hours to put something at play to maybe keep another person alive. So it's very important and it's very necessary. And so, you know, when they asked that we come and kind of talk about the work that we do, I said, sure, you know, we'll come and explain anything that anybody wants to know, and then some. So we're open for questions unless.
Okay, Commissioner Prezi.
Yeah, I just want to say quickly, when I went to NACO and I was in DC, I ended up getting to have, I went to the session that was about justice and juvenile justice, and there was a lot of conversations, and somebody presented on some work that was being done in their community that was having some really great impacts and some really amazing numbers and results. And afterwards I kind of stopped them and I asked them, you know, tell me more about this, and they pointed me towards Cure Violence Global. And you know, in reading your model and the work that you've done and what you've been able to achieve around the country, it's really, really impressive. And I think I'm excited. Thank you, Pastor Duncan, for saying you want to be collaborative, and for the city for saying we're better together, because I think that is going to be the key, us all coming together and coming up with a collaborative model where we're all going to figure out, you know, how we work together to make this happen. And I think that that using an evidence-based model like this that has the proven track record of experience and understanding and evaluation, and using that social determinants of health as a core kind of structure for the way this is done is really, really critical. Because I think if we try to tackle this just with fits and stops and we don't have that framework, you know, we're really going to be at a loss at the end of the day in terms of what we're really achieving. And so I'm excited about the togetherness. I'm excited that y'all were willing to come here and talk to us and share your model. And I'm looking forward to seeing how a collaborative proposal gets put together that could use your model and hopefully have y'all at the table to help train us on what that looks like. And thank you, Joe Camilla. I'm excited to feel a little fan fair right now.
Oh, yeah.
And I'm all like,
there's a whole lot of suppressed fandom.
Right, yeah. But I guess.
When in a ring does that.
Right. But I do wonder, I'm wondering how you're plugged into the Cure Violence program, and could you tell us a little bit more about the one city model that you're.
Yeah. Well, first I want to thank my teammates for coming down. I think that this is something that's very special. You know, Kobe Williams is somebody that has inspired me for 15 years. There was a documentary called The Violence Interrupters, and I wrote out a tweet about it 15 years ago, and he was like, hey, that's me. Let's go have lunch. And we ended up having lunch, and we've been working together ever since. And it started off on a real grassroots level, just going to playgrounds, and just I wanted to help in any way that I could, and I saw the power of the work. You know, you go into classrooms. This is when I was playing with the Bulls, obviously, and you go into classrooms and you ask the kids, like, how many of you have been affected by gun violence? And when the whole classroom is raising their hand, this is not what I wasn't raised like that. You know, I never saw anything like that before. And I was just always asking Kobe, you know, what can I do to use my platform to help? And, you know, we started this one city basketball league where Kobe was working with 28, we have 28 different violence prevention groups playing basketball with each other. And this is all because of this man right here. You know, not everybody could unify the city like that, and it's having everybody under one umbrella in the gym. And it's the work that I've done with Cure Violence, because they are connected, has been way more powerful than any championship, any win on a basketball court. So this is bigger than basketball. We use basketball as a hook with this one program, but the way that Dr. Williams, the way she talks about violence is different. This is a public health issue, you know. So I know that we have a platform here in Gainesville. I left my family. I got on the plane because I know that this is important, and I wanted I wanted my people to know that they are supported here in Gainesville, because this is where this was the glory was here, you know. And I think it's important also for our athletes at University of Florida to understand that we do have a social responsibility. And I think that we haven't done it. You know what? I wish that I would have done this earlier. You know, I'm almost 40 years old now, and it's time to be able to, the little that I have left, you know, I know they were good times, but now it's something that's really serious, and any way that we can help, we will.
Well, thank you for being here, and I hope you know, that better together and that idea of collaboration. I hope we can bring UF to the table too, because you know they are the 500-pound gorilla in our community, and in a good way, and sometimes in a not so great way, just because you know there's so much. There can be so much distance between the university and the community sometimes, and in terms of understanding and the goals that we have. But I think this is a common goal. We all want our community to be safe. We all want a place where the students can thrive, where our community members can thrive. And I hope that you know the university will come together. And I'm excited about your leadership, and thank you for stepping up and being willing to be here today.
Thank you.
Madam Chair, I have a question. A quick question for you all, but I want to tell you that the low point of dumping in a dumpster at Westwood, the high point was meeting you 20 years ago when you came to Westwood to share. So I remember you very well. Gracious young man.
Thank you.
Big pretty smile. I want to know, what is your involvement here with us in the community? What are you all going to be doing for us here in Gainesville?
Sure. So if, you know, we partner here in Gainesville, we are, you know, the technical assistants and trainers, okay, right, in the model and how to do the work. You know, we pride ourselves on being like data driven, and it's a, you know, scientific evidence-based approach. And so you get results when you're sticking to, you know, the fidelity of the model. And so having us here to like kind of ensure in the implementation phases and stages, okay, and doing the booster trainings and okay, just being on the ground, data reporting, all of those great kinds of things.
Okay,
so
great. That's what I was curious to know, how you all are going to be working with us here. Thank you. Thank you, Madam Chair.
Thank you. Any additional questions? Dr. Hall?
Being the resident data nerd here, I was really taken with Pastor Duncan mentioning that there are 700 people on parole in our neighborhoods who may be at risk of participating in violent exchanges. And the first thing that jumped into my head is, Pastor Duncan, you know a bunch of them. What do they need from us? We need to know. Aside from getting them out of jail, hallelujah, they're out of jail, but then we just neglect them, I think. And there may be ways that we could provide some of the supports that would keep them from participating in violent adventures.
Yeah.
Come on, Pastor.
Somebody give him a mic.
Go ahead.
Yeah, I would say with, we've been working with Ms. Cheryl. And again, you know, we can identify specifically and exactly where this violence is occurring at and who may potentially be causing the violence. So I would say what we attempted to do with the ceasefire, the pastors group in GPD, was we attempted to mentor them. Mr. Marhead, I guess you don't mind saying that, he's been one of my mentees. And so I want to say this. I just lost my mom last week, and I should have been there. And I wanted to be there with my family, but I came here because I understand how important this is. And so Mr. Jarrell, he is a mentee that I've been working with. And again, I'm just so proud of him, but there are other young men like this. We just need to come alongside of them and work with them. So if there's anything that we can do as a community, we need mentors. I know we talk about mentors in the school, but we're talking about mentors who are at risk. And Ms. Chow Kafun, she has been the probation office has been supportive. I know that there are there's some folks on the court service side as well that we've been working with as well. But we have to get alongside of them. There's more young men, young women like Mr. Whitehead. And let me tell you, I was more proud of him on Wednesday, but we'll have a talk after this. But I've definitely pulled him under my wing, and he's also a community health worker. So on top of doing what he does part-time for me, part-time, he actually helps facilitate our food is medicine program, where he works with over 150 people a week and 50 people that are actually in programs. And he just started actually doing A1C testing and lipid testing. So, but above what he's doing with Sees Violence in the Hood, that's what he's doing. And so there are other young men, but we have to be able to see the need and the investment. And if you never see me again and you see him, know that I had something to do with that. And there are 700 young people that are out there, and they need us, specifically African-American males. We need to come alongside of them. And we need to say, hey, look, I want to work with you. We're together almost every day. And if I'm not going to see him, I text him and I tell him that, hey, look, I'm not going to be there today. Or, I tell him, you're running late. You're late. And that's what it's going to take. But there are other young men that are out there that we need to stand aside. So I didn't want not to show up for him today. But I wanted to come because, he is someone who has really been dear to my heart. So if I would answer that question, and again, the 20-year work that I've been doing in the community, Dr. Hart's been a mentor to me. I still look at the Losswood County data report card and the work that they did in the swag area. That was a lot of great work, and kind of looking at that. And a lot of the work that we've been putting together, what I've invested in him is what has been invested in me.
Pastor Duncan, thank you for being here. I'm really sorry to hear about your mom.
Thank you.
I lost mine not too long ago. It's a hard journey to go through. So
yeah.
Thank you so much.
This is helping right now.
Yeah. Commissioner Prizia had a question.
I guess I just wondered what you thought would be the next best steps, given that you came up and said you wanted to develop that collaborative proposal. Like, how can we support y'all to get that proposal done and then get it back in front of us so that we can take a look at that in collaboration with the city and CTAC and think about how we can provide the resources that are necessary to make this move forward? Because, we, like you said, we have had 12 deaths since the beginning of this year. We had 14 last year. We've had 12 already this year, and we're not even halfway through the year. This is a real problem in our community. I know that doesn't sound like a lot to y'all who may be from Chicago, but for us, that's a big deal. That's a lot of people. And that's not the guns fired shot. That's just the people who died as a result of those gunfires. So what can we do?
And we have a great trauma center that saves people who would die elsewhere.
Yeah.
So.
Yeah.
So,
and how long, and what's next steps?
So I would say, of course we brought Cure Violence here, and I don't want to do it without them. Because I was in Savannah. So while my mom was in the hospital in Savannah, they actually have a unit in the hospital that works with families who've been impacted by gun violence. And it just so happened that I have a family member that works for the city of Savannah, and I wasn't thinking about no Gainesville. I wasn't thinking about no Sees Violence in the Hood or no Jarrell Whitehead. I was thinking about my family. But I was convinced to go down the hall, where they have a program there that's a part of, what Cure Violence does, and, families who are impacted by violence, and so that's where I kind of looked at it and said, hey, look, I want to kind of be involved with this, and I don't want to do it without them. I'm not saying that I'm not going to continue to do the work, but we've developed this relationship that I believe that will help our community. And again, they're not just here for me, they're here for all of us. And to be able to have their support and to have our Gator Great support, this is a day of reckoning for our city, for us to be able to come together. So the next step is that, we have a conversation. We've already had some conversation with Mr. Alexander and Mr. Caleb Young, and we need to come together as men, and specifically as African American men. Because the truth be told, and I told Mr. Whitehead that that they wanted to do something. I said, no disrespect, but a lot of these kids may be kids that, you may be some of your sons, maybe some of your sons, your nephews, you're related to these kids. And if we don't come together, you know, then it's gonna be even worse. And so I have a long conversation with Mr. Alexander and Mr. Caleb Young, and we've talked about what we can do together, because, you know, having these proposals that again, we did not know. If we would have known, then we would not present it. But Cure Violence probably wouldn't have been here as well. But I think there's a good opportunity for us to be able to work together, because, you know, the counties, all of you, all my friends, the city, all of them, my friends, but John, everybody, we're all family, right? And so we need to come together and figure it out. So next steps is, you know, in the next week, when I leave here, I gotta go with my family, figure that out, and then I'll get with Mr. Alexander. I told him next week I'll probably have a more clear head, and then we can talk about how we could come back together with a unified front to present for our community.
Thank you, Pastor Duncan. Commissioner Cornell, did you have a statement?
Well, I was gonna ask actually Mr. Smart and either Commissioner Duncan Walker or whoever here is representing the city, Brittany or Mr. Alexander, that same question. Because I think from our perspective, I'm wearing two hats today. I want to put something on the table for our CTAC board, but I also want to actually talk to my county commission board, because CTAC, we have some current, I think, funding that may be available that's unallocated that I want to see if the board agrees with how to use it. And then our county commission board, I want us to get some direction for our upcoming budget, because I think all of this requires resources, and we have experts in the room, and we need to provide resources. But I want to do it the right way. So I want to hear from our city and county leaders as far as what the next steps are before I make a motion. So I kind of wanted to hear from the city, and then I've already heard from Mr. Sparks. And thank y'all so much for being here.
Thank you for being here.
Maybe before that happens, if we have some other questions for y'all before we switch off here?
I just had one question. It's Dr. Williams. I'm not familiar with your model, but you mentioned that your role in other communities is TA and training. Are you also the backbone in other communities for this collaborative effort, for collective impact, or is that somebody else's role?
That is somebody else's role, right? Because you want it to be locally sustainable, right? And so, and we don't want to have to be there forever, because we're, right, the community is yours. And so it's really about setting up sustainable strategy in communities. And then, right, using us or needing us maybe like less and less as the years go on, and as you kind of strengthen the local capacity for implementation.
So in other communities, who has the home often then of?
Mayor, county?
So
It's usually
essentially,
what is
right, there's
the
like
mayor?
an implementation agency, maybe like a mayor's office. Sometimes it's a health department, local health department, state health department. It just depends on the municipality, and yeah.
Everybody else first.
Everybody else first, okay, Dr. Lombardo.
Thank you. Thank you. I really appreciated hearing your strategy. I think, you know, we've heard that this is now a priority both for the city, for the county, certainly for the trust. I think it should be a more national one, but I think we have a rare opportunity, which is a well-documented, evidence-based, this is the thing that as a trust board member, we have been really trying to emphasize, is that we want to use things that have been shown already to be effective. And I think when we have Brittany's presentation showing us that there is now a concerted, collaborative effort, you know, I think we should be less concerned about where the home is, although I think it sort of naturally has one already defined, and really think more about how we resource it. Because as I looked at our agenda today, and I'm listening to what everybody has said, it's not just this, it's the entire agenda. If we don't do this whole agenda, we're going to be still here with a different crop of kids. Every time we turn around. So we have to do it all, but to have a focal area, a focal point for collecting this information and having an evidence-based approach to dealing with the current health crisis, which is what this is. It's like any other health crisis. I think we cannot pass up this opportunity. We got to figure out how to resource it. Combined, all of us together, because that's really all of us are paying the price for neglecting this and not doing what we need to do to deal with it.
If I could just chime in for a moment, I would like to hear from
Can you pull up
how
the
they
microphone?
how they deal with the youth in terms of the basketball leagues, and to get more into that in terms of giving our youth something else to do too, because I think that that's a real good part of this program that I've heard so far. I think that I'd like to hear more about that.
May I piggyback on that a little bit too? Because Ms. Williams, you appear to be a very humble man, because this is your program and you have said little to nothing. So thank you very much. But my question is, and a lot of people don't even realize it's a problem in Alachua County, is that there are gangs everywhere. And we have a real gang problem here. So, as you're talking about the basketball, what I would like to hear is about, number one, how do you give an alternative to the gangs, and what do you do, to try to draw the young men or young women out of the gangs? And then what happens, because I'm sure there's resistance from the gangs because they're threatened by the fact that you're taking their lifeblood. So if you can incorporate that in your answer, I'd be very grateful.
So good afternoon, everybody. So I'm just the director of the U.S. programming, but this is the boss. She the boss. She's the executive director. So I just want to say a few things. So I started off myself as a kid, part of the problem. So I was exposed to violence at an early age. My father went to prison when I was 3 years old for a murder. He came home when I was 10. He got killed. So I turned more to the streets myself. Started gangbanging, selling drugs, and making a lot of bad choices. I did 12 years of my life in prison. So my grandparents always stayed on me about making the right choice. But at the time, I just wasn't ready, because I wanted to see how my friends saw me. So how my friends saw me, I wanted to stay hip and stay cool. So once I started doing this work over 20 years ago, I started off from the street like a violence interrupter. I was one of the first violence interrupters in the community to do this work on the south side of Chicago in the community called Inglewood. So as me doing this work, I started really seeing it was working. What made me bound to being a part of this organization was we meet people where they are. We not judging nobody. We ain't looking at people as good and bad. We understand people make choices. We ain't saying it's the wrong choice. So when I knew our approach was just to meet people where they are without judging them. Our job ain't to tell people they shouldn't sell drugs. Our job ain't to tell people they shouldn't be in no game. Our job is not to do none of that. Just meet them where they are and keep building relationships. This work is all about relationships. When you meet people where they are and building relationships with them, you get to know them, they get to know you, you just building with them. So once I started just building with them and getting to know them, at times I felt like I was a hero, because it's like I'm meeting these people, I'm saving life, but we changing their mindset, we changing the community norms, we getting everybody involved. So doing this work was one of the best things that could have happened for me to do this work. Like I say, I was part of that problem, and now I know when you hire the right people to do this work. And when I say the right people, the people who do this work are from the community. I was born and raised in from the community. So that's what we do. So we got a system that works. We've set up training, technical assistance, but the people be doing the work out from Gainesville if the program was here. It's people in the community who have the relationships and who could really relate to the young people. So it's important for everybody to be a part of it, but it's just roles and responsibility that everybody got to take. But everybody got to be together, because it's important to know this. It's not about none of us in here. It's about these kids. They really calling us. They really need us. I went to speak at a school today, and I was really disappointed. I'm just be honest with you. When I spoke with a school today, because we talked to about 60 students, it's teachers, principals, everybody is there. I was happy, it's always good to speak to the youth and hear from them. A lot of times we don't include them in the conversation. We always make plans and everything, but we don't hear from them. So I wanted to hear from the students today, and a student said, I say, want them to be able to speak their mind, how they feel. And they said, man, the teachers always hollering at us. That's not no good approach. Hearing what the students say, they always hollering us, and hearing teachers. When you hearing teachers say, how do you get along with a person you don't even like them? Like talking about a student. So, to hear this, man, we got to do more. We got to listen more. We got to understand that these youth really need us and they calling on us. So it's important for us to listen more. It's important, and it's important for teachers, school teachers, superintendent, everybody. Man, treat these kids like they're your own kids. They need us. And the last thing I want to say is the Cure Violence model. Like I say, I'm not here to sell no model, all that, but when it works, it works. When you hire the right people to do this work. We got over 23 evaluation prove it works in these communities. But I want to thank Joaquin Noah so much. And the reason I want to thank him, I remember 15 years ago when we first met, like you say on Twitter, he said, Kobe, man, when I'm finished playing basketball, I'm going to be working with you. So we started doing this one city tournaments. At first we started on a small scale, 6 teams, 8 teams and all that. Now we're working with 28 violence prevention organizations bringing the youth together. And basketball is just a hook. We got workshops, family literacy, different things like that. So we use the basketball piece just to hook them, but to have all these violence prevention organizations working together, because they usually don't need to sit at the table with each other. You know, they work in silos, but we use this piece. And what I loved about it, Joaquin Noah went to the state of Illinois, and this first time it said been done. He went down to the state rally and everything. They gave us $2 million to do these one city tournaments. So all the players get paid $50 a game. The coaches and assistant coaches, trauma informed coaches and all that, get paid. We got the referees. We got everything. It's community based. So everybody who getting paid off this is from the community, and they're part of the community, and it's coming together. So this one city is just, Cure Violence in One City is just a partnership, but when you do other things and create other lanes and show these kids by rewarding them with something, it help out. So I just want to say we happy to be here, but we know we've got more work to do, and we just a piece of the puzzle, but we know it's important for all of us to work together. And thank you.
Thank you.
That was fabulous. Any further questions before we sort of switch gears here? I just had one. Pardon?
There was a question for Brittany that I don't think she's had a chance to answer.
It was on the next steps piece.
Yeah,
And
Brittany.
invite. It was on the next steps piece and what you all envision for us moving forward. And I see John Alexander over there, but I think absolutely the next steps, and Mr. Smart mentioned this before with the Alliance, the last meeting that we had, we talked about the importance of the budget and what that's going to look like, how we want to structure the Alliance meetings, and how we're going to fashion this moving forward. So I think that next piece is the Alliance, figuring out how we can, once the signatures are done, we're able to execute it, because we have had those conversations about what the budget is going to look like, how can we partner. I can't tell you today that they've all been fleshed out, but it has to involve all of us collaboratively, and those are the beginning steps to that conversation. So I hope that answered the question, and I'll, let you all add to that.
And if I could just also ask a question before all these folks leave the table. I wrote down the documentary, The Violence Interrupters, but if there are any resources that you all can ever recommend to us for, whether they're documentaries or whether they're books or whether they're, studies or anything that you think would help us better understand these questions, I would love that if you would share those with us. I think, at least me, I'm a nerd that way, but I think most of us are always, we get we get things at conferences from other cities and we share those and things, but to hear from your point of view, what you think of as good resources, I would be very much interested.
So anybody could go to cvg.org. So it's Cure Violence Global, but you just say cvg.org. You could it talk about a lot of best practice. It talk about a lot of studies and all that. And also, I got a book coming out in July talking about interrupting the violence and a lot of that. Yes.
I kind of heard that.
And Joaquin Noah did the for it. So your very own. So yeah, cvg.org.
Thank you. Thank
Maybe
you very
you'll come
much.
back and sign some books.
Yes,
that
I would love to.
I think that'd be
Do a
great.
fundraiser.
Okay,
Especially if you're working
I
here.
So I know there were other comments. I just wanted to ask that before y'all all left the table. Commissioner Posey, did you have something?
I mean, I guess I feel like, I'm with Ken. I mean, I have a love for this model. I was really impressed with the data that I've read and excited about what y'all have achieved, and I'm excited that y'all are here and willing to take the time in the community, and I'm excited that the city is making the investment in having you here, Brittany, and really trying to think about it and being willing to come back to the table and say, we'll work together, we'll come together, we'll collaborate. And so I just want to make sure that we don't lose this opportunity. So and I know we need to think about budget, and we need to think about the future, and we also need to think about right now. So I just would like to make a motion that we ask staff to work together with the CTAC board and our board today, and I guess in the future with the city as well. They're not here today, so I don't want to use their name in vain, but to explore and put together the budget needs for implementing the Cure Violence model in Alachua County.
Okay, and then so that's a county commission motion. I wanted to put a motion on the board for CTAC.
Okay.
So that motion for me is thinking about the 2023-2024 budget cycle, because we actually are kicking off our budget cycle tomorrow. We're having the constitutional. 24-25, sorry.
I was confused.
And
I think I was too.
yeah, sorry, 2024-25, which starts October 1st. And I think, to have the local impact and the local community workers, and to hear what the city has brought together Thursday at the meeting, I was at that meeting, and to see this momentum that's happening, I want to do kind of some immediate stuff if we can do it, but our budget cycle really doesn't allow for that. So on the CTAC side, this year we implemented our strategic plan, and we put aside 10% for safety. And we've allocated some mentor dollars that is being spent. But when I met with Marcia a couple weeks ago, there's still some unallocated dollars. And those are, if we put those on the table, I think that could provide some immediate funds from CTAC, as long as it's used for 0 to 18, and it's used in coordination with the city and the county's efforts. And so what I would like to move is that we direct our CTAC staff to work with the city manager and the county manager to provide up to $250,000 of one-time funding to enhance the community-based program gun violence efforts, which is what we're talking about today, and bring back recommendations within 30 to 60 days for the CTAC board to consider funding immediately in this budget cycle.
Okay, we have a motion. Do we have a second?
I'll second it for discussion.
Okay, we have a motion and a second. Their motion was first, so they probably should go first, and then we'll do ours.
I do want to make a point too, to say, Darrell Whitehead brought this proposal to us, and I want to be really mindful of the fact that he's chosen a life to take some leadership and to step up into that role. And so I want to make sure that that's honored as we move forward with this, and that Cease Violence in the Hood. I saw the city bring forward other proposals and programs, and I know that there's been other interruption programs, and I'm excited for them too. And I want to, like I said, I want to see a collaborative proposal that works, but I just want to honor the work that Jarrell and Pastor Duncan have done and lift them up as leaders who are willing to look for an evidence-based model and bring forward something that's really going to provide
I understood
that.
the Board of County Commissions motion. It actually included Cure
Violence Global and,
so
and Cease Violence in the Hood.
I think that brings it all together with regards to the CTAC funding with the city and the county.
Yeah. Okay.
How that looks,
Right,
I'll leave that to our leaders, county and city leaders, to bring back the proposal to tell us how that looks. But I think an evidence-based model is important. I think local involvement, you know, the things that I heard, meet people where they are without judgment. If I could teach I mean, that is the key, right?
Create other lanes, I
Yeah,
wrote
create to reduce killings and shootings, period. Period. To have, I'm a UF grad. I love basketball. To have our local, I see Torian back there. I mean, to have our local folks that are saying, we're here and we want to implement and bring the local leaders into this program. That, we've got all the pieces. And to have UF, they will come up because Joe Kim's going to say, hey, y'all going to come up? I mean, so I can just see how this is happening right now. And with the leadership of Manager Curry and what I heard on Thursday and Mr. Alexander, I think we've got all the right pieces. We just have to give them the resources and then let them tell us what to do.
All right, Commissioner Prezia. Oh, sorry, Dr. Lombardo.
Thank you. So what I'm hearing is you guys are beginning your 2024-25 budget cycle. So, and the CTAC money is this year, current year, unallocated money. So what I would want for that proposal to consider is, because this is not a one and done.
Right.
So if we use the CTAC money, which is current year, to kick it off and get it going, then what we need to make sure is that
it's sustainable.
It's sustainable, and so that budget cycle may serve to our advantage in that regard, but we need to make sure that they're coordinated funding streams so that we don't get started and then have an interruption and then we have to step back. So we really need to, I think, have that understand that this is a ongoing project for which we happen to have the seed money on the CTAC side.
Well, and we do have some flexibility at the county with our revenue recovery money from.
Yeah, if we want to do something in the current year.
So I mean, if we end up needing some bridge funding or something like that, like I'm sure that Manager Smart and Manager Lieberman could figure out how to help partner with CTAC on bridge funding.
But I don't want to lose sight of there's 6 items on this agenda, all of which hold together into this whole issue.
I agree, and I think there's going to be need for other things to fund as well. But I do think our motion being first may give you the assurance that you might need that going forward we are committed to working with our budget to make sure that this happens. And so
speaking of the agenda, we still have 3 more items to do.
Right.
Sure
So if
enough.
we
have
could
a committee person who wants to speak too.
yeah, well, we will take public comment to the motion. So if there is any further comment from our commission, we will ask for public comment on the motion. Well, we can take public comment for both motions if that's okay.
And Ken, would you repeat yours again?
Yeah, mine is the move that we direct our CTAC staff to work with the city manager and the county manager to provide up to $250,000 of one-time funding, that's from the safety, to enhance the community-based program gun violence efforts and bring back recommendations within 30 to 60 days for the CTAC board to consider immediately funding.
Okay.
Okay, is there any public comment to the motions? If you would, please come forward.
Public comment, Desmond?
I think we're losing.
Nope, they're all like, all right, my work is now done.
Thank y'all very much for coming.
You did a good job, you guys.
Not like there's that many flights in and out of here.
Right. There's one flight right now. Thank goodness they're using our airport.
You know, it's like 6 in the morning, 11 o'clock at night.
No, it's 4 to.
Okay, we have some public comment. Okay. Commissioner Dr. Walker.
Thank you very much. And I just simply wanted to take a couple of moments to move this braid out of my face.
You succeeded.
First things first. It just had a mind of its own there. But to say thank you, and I know that many of our presenters have had to leave, and so in their absence, and perhaps they'll go back and take a look at this, but certainly I'm sure the message will get back. I am incredibly grateful. When I came to the commission in 2001, I started my work on gun violence, and that work was well before the summit. We had a town hall that had over 1,000 people that were present who gave plenty of data. I mentioned this back in our meeting last Thursday, so for anybody who is interested in data, I invite you to go back to that. The city, I believe, is trying to aggregate that in some ways, but my point is this. Even before the time that I entered the commission, we have known that we have faced issues. The problem is we have watched those issues proliferate. We have watched the individuals who are involved in gun violence get younger and younger. It is a heartbreaking thing to have to reconcile. There is no magic bullet. But I will say that when I put the motion forward on the floor to address gun violence as a public health issue, it was with the understanding that we needed all hands on deck. And so please understand that I'm sitting back smiling and my heart is happy, because it's almost like having a dry mound of hay, striking a match and dropping it and watching it just go, in a good way. Not to destroy, but to build. If we're destroying anything, I hope that we're destroying the violence. I hope we're destroying the culture that is violent, because that's a part of this. I heard somebody ask, what is needed? I've had conversations with kids in the community, and they have said they need 4 things. We need places to go. We need things to do. We need mentors, and we need jobs. Places to go, things to do, mentors, and jobs. I ask my colleagues that that become our mantra that guides our work. When we start thinking about what we must do, it's not about us scratching our heads and saying, wonder what we need to do. It's not even about reading a book or watching a documentary. This is literally what the children here locally have said that they need. I have pictures in my phone of an interaction that I had with some young folks at the Summer Sling Greater Duval Neighborhood Association program. And for those of you who are not familiar with that, I know pretty much everybody around this table is. It is a phenomenal program that does great work. But is that my time?
No. It is, but we'll give you a little
I'm so sorry,
you're as a city official, you get a little extra here.
And I won't even do that. I want to be fair. But these young people have been some of the individuals that have given us a lot of great information. That's who we need to be tapping for this information. We've got to tap the kids. Not only do we tap them for the information, we put them in charge. One of the things that I learned when I was working in Miami, Florida at the African Heritage Cultural Arts Center was that if you put a child in a leadership position, you will watch them shift. First of all, you'll get a chance to notice growth in them, and you'll have a chance to guide that growth. But then you'll watch that same child influence the next. The peer pressure and peer encouragement element is very real, and just as it works in a negative way, it works in a positive way as well. So I would encourage us as we continue our work that we begin to build frameworks and we begin to build infrastructure that supports young people leading us in this effort, because they are truly telling us what to do. I was glad to hear someone mention the arts. One Nation, One Project is a phenomenal program. Also, we had another play outside of Who's in the Box. We had Never Had a Friend by Dr. Micah Johnson, and that was a phenomenal one-man show that also received rave reviews from the young folks who want more of that. So more of these cultural experiences for them to see themselves and for them to participate. You all know that I'm a person who loves the arts. That's part of my background, and I know the power of it. Worked at the African Heritage Cultural Arts Center in Miami and watched that whole center change and save lives. I put on the floor at the city for us to do a cultural arts center here, and that is something that we are in the process of trying to flesh out and build. Why? Because they save lives. I'm so grateful. I heard 2 people say during the meeting that everything on today's agenda addresses these issues, and you are absolutely right. I'm so grateful that we are talking about all of these issues today, because all of them will be a critical part of how we address gun violence. And I did want to add this one final piece. My colleagues have also heard me lobby for one more thing, and that is the home of all of this work. Most times, in the absence of a strong mayor form of government, you all know we do not have a strong mayor form of government in Gainesville. So many of the gun violence efforts that would normally come out of a mayor's office can't, because that's not what we have here. But in the absence of that, many communities around this country are adopting offices of neighborhood safety. Some places call them offices of violence prevention. It is a way for us to create opportunities for organizations like you've seen here today. I want to recognize too, aside from Jarrell, there is a gentleman that I have also worked with. I've worked with Jarrell as well, but I also have worked with Adrian Price. Adrian has been another young man who's been doing wonderful work. When we talk about folks who've been there and done that, and you heard the young man that was sitting here talking about being able to meet people where they are, these individuals are so critical and crucial. So you heard one evidence-based approach to doing that work. There are others like the credible messengers that you can look up and take a look at if you want to find other ways to provide mentorship opportunities. But I also wanted to shout out Adrian Price because he's also doing wonderful work in the community, and he has previously been an individual who was justice involved, has come home and wants to be a part of the solution. And I'm so grateful to see that. I want to thank city staff who are here doing wonderful work. And I just want to thank the Children's Trust and my colleagues over at the county, because you all are all essential, critical pieces in this. We will not solve this overnight. We're going to lose a whole lot more sleep, but I think all of us are prepared to dig in. And I did not mean to leave out the school board, Tina, because you guys are absolutely, good God. You know, I was over at Duval the other day. That is my school. And Gloria Jean Merrick's, who someone was talking about, was my 5th grade teacher. So all of these components work hand in hand, and I'm just grateful to hear these conversations today. Looking forward to being a part of more of them, and thank you, thank you, thank you. Let's continue to build, because that's what we're doing. We're
Thank
building.
you, Commissioner.
You're
Thank
welcome.
you.
Thanks, Deb.
Do you have any further public comment?
I think my team is making me say something back here. They're pointing at me, say. But really quickly, in the interest of time, John Alexander, Director of Government Affairs, Community Relations, the Office of City Manager. I just want to say how grateful I am for the presentations that were done today. Career Violence Model. I was up 3 o'clock one morning years ago, and I end up watching it on PBS. And we actually brought them here. I mean, it was well over 10 years ago. Amina, some of the characters that were there in that documentary. But this is it's an awesome opportunity to collaborate, and this hits home a little bit different for me because those dots up there, those are the neighborhoods I grew up in, and you know. I didn't always look like this, I'll say that, you know, but have an opportunity to get on this side of the fence and reach back in my community and working alongside of the county, Pastor Duncan, Jarrell, everybody. I think we have an opportunity to do something good, and it's not about one particular program. And I want to reiterate that because I've been laboring in this community for over 2 decades now, and it's never been about one program. No one program has had the answers. And that's near and dear to me because I'm putting some of my Riker House kids in the ground, and that stings a little bit, you know. And so I thank everybody for being here, and I look forward to the great work that's going to come out of this partnership. Thank you.
Thank you, Mr. Alexander. Thank you. Go ahead, sir.
Hey, Adrian Price, Lucy mentioned. Everybody's looking around. Adrian Price, current president of the Justice Club at Santa Fe College, the student organization, current student at Santa Fe College, a part of the radiography program, which is a huge hurdle for me personally because Black and White in law say I shouldn't be in the radiography program because of my charge. Also co-defendant to Jarrell Whitehead's a coincidence. I don't know how it happened. I don't know who planned it, but it is what it is. Also a board member, obviously, of Strong-Minded Mentoring. And so the word of the day for me is report. For people who don't understand my Southern dialect, RAPPORT. And in that case, I'm speaking of that because Strong-Minded Mentoring, Jarrell Whitehead, every organization, NBA, since we was, since that was the elephant in the room, the NBA, they have a face of their organization. Somebody to put everything on and say, hey, we're going to promote the NBA this way. We're going to accomplish our initiative by putting this face out there. You know, and I see Jarrell Whitehead and Strong-Minded Mentoring because of that report, right? And like Kobe Williams said he grew up in that neighborhood, therefore he was able to impact that neighborhood. Obviously, I grew up in a Duval community, Jarrell Whitehead. We literally know just about every violent community. We know somebody there. We can ask around. I know that person who got shot. I know who they're akin to. So people like us are able to go to those communities and actually get answers, get information, get responses. You know, otherwise, because we was in that world, let's just say, before, so we understand the mentality. We know that pretty much what I'm trying to say to wrap this up is that we should all get behind Jarrell Whitehead and strong-minded mentoring and use that as a face and support and give resources to that organization to make this movement. Because what strong-minded mentoring has done with so little resources, you know, and connections, what they've already done so far is amazing. You know, the story is amazing. And literally, I'm a hero. Jarrell Whitehead, we are a hero where we come from. People don't do the things that we're doing where we come from, especially going through what we went through. So I just wanted to point that out. And that's all I had to pretty much say. And I am Agent Price. All right.
Thank you so much.
Almost didn't see him, he was sitting right behind me.
She left, so you're in charge. I understand you're vice chair.
I think we're taking
We have one more
public
comment.
comment.
Yes.
One more public comment.
You sit here.
Yes, ma'am.
Well, I was just sitting back there and I said, well, let me just come up. I'm Pamela Hawkins, and I'm so glad to be back in Gainesville. UF grad, love sports and all that. But when we were talking about, now I run a nonprofit, Race to Overcome, and it's in the Blunt Hall building. And we were talking about better together and collaboration, which is so needed. So as I was looking, I thought, just read, because you have 3 minutes. Race to Overcome, Love Blooms Here, a vision to transform challenged lives to wholeness, wellness, and safety with a strong, safe, equipped kids and parent lifted in the I, C, and U values. Better together, goal. Florida's 67 counties working together to keep kids strong, safe, and equipped, aiding in community resources and making neighborhoods whole with community outreach, educational services, and compassion. One life is not important except the impact that it has on others' lives. And Jackie Robinson wrote that. And it is so needed. And I'm so vested in collaboration with a common goal. Because when I becomes we, then illness becomes wellness. And I know when I think back of the things that I do in science and wellness and advocating and fighting for wellness and well-being for others, because children are born, they grow up, connect with other human beings, adults, they create families that create communities. And from strong trunks, from little seeds, strong trunks are built, are made. So when I think back of, I'm just gonna read some of what my desire is to be a collaborative link in what I can give. When I share a little bit about Grace to Overcome, a life-enriching mission-based nonprofit organization committed to helping others pursue excellence, hope, and family wellness as an active life goal. A 2030 vision to transform challenged lives to wholeness, wellness, and safety. And this particular that I had in my book was that I was asked to write a program for women transitioning out of prison. And during this transition, our goal is to facilitate each woman with the necessary education and services to promote healing and restorative care. Awareness is a powerful tool for wellness and well-being. Understanding how those tools work to awake a fresh vision of wellness looks like for them individually. Symbolizing the butterfly, a powerful beacon of growth, new beginnings, hope, rebirth to wholeness, with a core belief that adverse childhood experience can have lasting negative effects on health, well-being, and opportunity. Childhood adversity and effects of toxic stress can be passed on to future generations. And some of the biology, toxic stress, okay, well, can I have that one more?
Just wrap it up real quick.
Okay,
That'd be
toxic stress can change how the brain develops and function. It can disrupt our immune endocrine and metabolic systems. It can disrupt our DNA, targeting certain high-risk genes as on and protective ones as off. The science behind executive function skills adults need to succeed in manage work, family, and relationships is successfully. In some cases, these skills have been fractured and were underdeveloped as they got older. And our desire is to be determined with purpose in healing and restoration and collaborating with any organization. And especially, I loved what the Pure Violence Model was saying, and I agree completely. And it takes all of us doing what we can in our own expertise area. And I know for me, I have worked with youth. I have been able to change and desire to change some of the narrative, so not so much from negative but positive. I just really believe when our children are behaving in certain ways, even in the school, not so much detention, but do you need to go to the recovery room? Because there's something they need to recover from. And when they go to the recovery room, there's something there. If it might need just silence. I've worked with some young boys and young girls that just needed, there was so much that happened before they got to school, they just needed a minute to be silent. I've watched right in front of me many a times working for children and families for over 20 years and seeing the change by meeting them right where they are and also validating them. I see in you value, and I'm determined on even every child I encounter that I stop in the streets, I see in you value. And that is so much of a missing link. Children need to be validated. They need to know that they are loved, cared for, and respected. And what does that look like every day? And some of them that don't get that at home. And some of them have never heard it. So I just couldn't sit back to say when they were talking about better together, and I'm like, you have your better together goal, which, and I'm here to be a resource and help to any way I can.
And if you had more there you wanted to read or share, if you get a copy to the clerk, we can get copies made for us.
Well, this was just some, but I do have programs and other things that.
Feel free to share them. So thank you very much. Do we have any further public comment? All right, we'll move forward with a motion for the County Commission. All in favor of the motion, please signify by saying aye. Aye. Any opposed? All right.
All those in favor of the CTAC motion?
Aye.
Aye.
Okay. Any opposed? Unanimous.
Yay.
Halfway through the agenda.
Yes.
Halfway through. Better break, huh?
That was a big one.
That was a big one, and it was, yeah, we knew it would be.
I think the next one's y'all too.
Yeah, this next one, homeless foster youth programs update. Who's giving this one?
Claudia,
I don't.
She's like.
I think that part of our challenge with these joint agendas is that we didn't assign anybody.
We tried to do that during our meetings, yeah. But I'm not sure if that always
gets.
gets.
It didn't really work at the school board meeting either. It seemed like no one was.
This only one.
Staff.
I know the last two are ours.
Yeah.
Okay.
So when we
Commissioner Pinkerton used to.
we were very clear.
Yes.
When Commissioner Pinkerton was the chair, he used to limit 1 to 2 items when we had joint meetings.
Yes.
Yes, I'm not sure how this happened.
And actually, I said
Not
that
anymore.
as well.
You put 3 of them on here.
That's why I made the motion I made. Stacked.
But, you know, I do think that some of the discussions that we've had about some of the past things that we've talked about today is very applicable to the things that we're going to continue to discuss. So we don't need to repeat ourselves about social determinants of health and all the other things that we know are contributing to all of these issues.
We did talk about this at the school board meeting.
Yeah. I mean, but seriously, there's a lot of, but I think getting an update on this is important. So I don't think it's going to be a long item.
Again, Claudia Tuck, Director of Alachua County Community Support
Well, thank
Services.
you for your presentation. It was great.
You're welcome. Have a good evening. We don't necessarily have programs specifically for foster care youth. There are, certainly it's identified that youth aging out of foster care are a targeted population of homeless individuals. The Homeless Continuum of Care has looked into the number who age out annually, and that is it's not a large number for this area, so it hasn't been enough for us to go for targeted grants, but anyone who is aging out of foster care could come to the county to receive assistance with rent and utility, deposits, move-in assistance, and also through the homeless continuum of care. The problem is typically youth in foster care, they've not been homeless. That's not considered a homeless status, so they're not going to be prioritized for homeless funds unless we reached out and were awarded a grant specifically for homeless foster youth. And again, our numbers right now are not sufficient, but we can again track them.
Yeah, and I just want to be clear, Marcia Kiner and I met specifically about this. We had a meeting a couple of weeks ago to discuss this very specific thing. And I just got back from a meeting in Phoenix where I found out about a program that they are just starting to implement, where they are providing, as when foster kids sign up to go to either their community college or to any job training program, they're providing a dormitory style housing with resources associated with that for kids that are age 16 to I believe 23. But the stipulation is that they have to be have been affected by the foster care system or aging out of foster care. And I was super impressed with that program, so I want to share that information.
How was that funded, Mary? Do they have
they got a grant, and I don't know I don't know where that grant came from, but that's on my list of things to find out. But probably
We're in
so.
a CTE program at Santa Fe. It's workforce housing. Just
And to
Yes.
go to Santa Fe, they can get a voucher. I mean, any
Yeah.
university, if
Yeah.
you come out of foster care,
Mm-hmm.
you get a tuition
Waiver.
Right,
Mhm.
for foster care, yes.
A lot of kids don't know that, and this is a way of funneling those kids right into something that takes care of them, which is I was very impressed with. But anyway, I'm sorry, Claudia, go ahead.
And youth are allowed to stay longer than 18, but it's a choice if they stay there. And they all have a caseworker assigned who should be working with them and guiding them. So we may ask for some report back from partnership who's working with them.
A lot of what you see though with those kids is they've been in the foster care system being told what, when, where, and how.
Right.
And they hit 18 and what they want to say is, see ya.
And sometimes the folks want to say see ya.
And I think this is one of the reasons why they started at 16 and not 18 is by giving them that choice to move into that environment sooner.
And
Yeah.
that kind of that more of a dorm-like, more of a you're a tenant, it is
Kind of transition to
it's a transition, and it's appealing to some of those kids, especially if they understand what their freedom to make decisions is, because that's the piece that's often. But it's another one of those you got to meet them where they are, and understand that saying no may be the most important thing to them at that particular moment.
But, did you have anything you wanted to add, Marcia? We had a really good meeting where we heard a lot of good stuff.
The only thing I would mention is our work with our family resource centers. That's really where we are funding assistance for homeless youth and families that may fall into this category. And we certainly are putting quite a bit of, looks like about $750,000 into our family resource centers, community-wide.
And I just want to say thank you for that, because when I heard those partnership resource centers were going to be defunded, I about fell out. Because they are such a lifeline for so many families. So thank you for stepping up and filling that gap. And I'm excited that it gives us an opportunity to think creatively about how those resource centers could be more than what they are with just the partnership funding, and to connect with the community health workers and with this gun violence prevention work and with what we're doing in other with workforce development. And so I think there's a lot of really cool partnership opportunities. I'm excited.
We are as well. We're very excited about what this model can be, and then moving the model out into our rural communities as well. So it's
Hawthorne's ready.
And we're working with them. We right now have one of our navigators is going out to Hawthorne to meet with the community there to see how we can stand up something like this in the not too distant future.
Well, I'll just point to, I know our staff is working, we've been working on like a 301 like needs assessment, sort of that corridor study, but when we had our meeting with Hawthorne like a week ago, you know, one of the things that was brought up is that resource center down there, and how they feel really kind of left out of the fray, and so I'm excited to hear that, and I'm excited to know what comes up as the sort of core need. So I'll look forward to hearing more
Yeah.
about that as you guys continue to develop.
Yeah.
Thank
and
you.
We
And,
might can make sure that we share what we're doing, Christy, with Mayor Randall already.
Thank you.
I received an email earlier today from you, Dr. Hart, about a potential collaboration, and I would be very honored to participate in that in any way that I can. But I think that I have concerns about other groups of kids that are homeless, one of which is LGBTQ populations, which are under real danger because the schools are no longer a safe place for them. And we have numbers we don't even know about, quite frankly, that are on the streets or in unsafe places or on couches or wherever. So I'm hoping that, you know, we can, and I know that's separate from this group, but I thought you might want to mention it.
I'll just say really briefly that the Women Who Get Shit Done group has decided that the best way to reduce the number of homeless children is to create a new collaborative of people who are interested in homeless issues. And Commissioner Alford, I would really appreciate it if you could help us identify someone who could make sure that we don't make missteps or leave out the LGBTQ children. And that's not why we invited you, but you may know someone.
I do know someone, and I'm happy to include that person in the conversation. But anything that we can do to address homelessness and youth is, and that's just one population, but I think that there are multiple vulnerable populations out there, and for a lot of different reasons that need to be addressed. So happy to help in whatever way I can.
And just to let you know, from a historical perspective, when this term was introduced at one of the CTAC meetings, we now call that the WWGSD group. So.
Okay, well, I can be a little more PC.
I think it's fabulous. I want to be a part of this WWGSD group. This sounds fantastic.
Fantastic group. No, they just tell me what to do.
All right, Mary Helen.
Just very quickly, I've been trying to work with Partnership for Strong Families too, with regard to this population of LGBTQ.
You turn your mic there around.
LGBTQ kids that have been hard to place, but they're also a group of kids that are they just have mental health issues that are hard to place in foster care as well. So, you know, they need specialized care. They need a team of people working with them. And I've been, ever since Hutch left, I've taken on the task of trying very hard to engage with Takachali for some of their facilities, because they do have empty dorms out there that could be used, but we keep hitting a brick wall. You know, it's a big campus, it could be walled off. I know they have concerns out there about safety and of the safety of their clients that are there now, but it's a big facility, and we already have a fire station out there, you know, that we've been able to lease that property. I just feel like, and HUD has already told us that they could help renovate the buildings to make that happen. So I don't know why we're running into opposition from those folks. We've been to the state. We've tried to engage with the commission there, and we can't get anywhere. So if you all have any connections with anybody in the state, at the state level, that we could actually get a dormitory space for some of these kids, the ones aging out, also the very difficult ones that we could put in place with a really good, strong staff of people that help guide them through their adolescence. You know, I just feel like that we have the resources in this community that are not being used, and frankly, it drives me crazy. I've worked in residential care. I know if you put together a good team of people, you can change a kid's life. And so, you know, having the facility here and not being able to access it, for me, is maddening. So if you all know of anybody, you know, let's pursue that.
So part of the challenge with that population is that most of it is Medicaid dependent, and that is one of the things within the behavioral health Medicaid space that is the most poorly funded and the most It falls under the get them in and get them out as quick as you can. So there are rates for therapeutic group care and therapeutic foster care, but the rates don't support the level of service that these kids need in order to be maintained in a home. And so, you know, that was a program I actually shut down at Meridian because I said, I'm not willing to participate in killing a kid by not having the adequate supports in the home, and the rates that I was being given
We're putting
were
them out in
absolutely
private homes where they're killing them there.
yeah,
You know,
it's a mess. But it is an area where there is just, and there's a lot of tension between the federal regulations and around group homes. They really do not like group homes. They want kids in individual homes, and so it's become harder and harder to do any kind of group placement. But a lot of these kids, one-to-one, don't do as well because they are attachment issues are so severe that they can't. So it's a complicated problem. They need a whole lot of wraparound services, and those are the kids that are in and out of crisis units all the time, as are the LGBTQ kids that don't get support in the community. They're also in and out of crisis units all the time.
So we put them on the street. Sorry.
Well, I mean, this is.
I know. I just couldn't do it.
I understand. No,
Couldn't
I
do it.
understand.
But this is where I think, you know, this is another place where we just need to look at collaborative solutions and collaborative funding and not just lean on the limited resources that the state is providing. So,
Absolutely.
and I don't think we have the answers right now, but I did think it was important to open this discussion up and start to have it. So, I want to appreciate your time, Marcia, in meeting with me and talking about, you know, what the possibilities might be and what next steps might be. And we discussed putting together, you know, maybe a group of folks to continue this discussion. And it sounds like Dr. Hart has sort of kind of taken that in her own hands. So
I would just say, when you find out how it's funded out there, I would be really curious to understand that.
yeah, and I that is on my list of things to ask.
How Takachali's funded, or?
No, the Phoenix program.
The Phoenix, yeah.
And I want to know where they're, how much it's costing them per kid and all of that. But they are, it's just getting started. They are signing kids up right now, so I want to follow it as well. So, but that to me was just such a bright answer, I thought, to a problem that they share, their community shares. So.
So is that the end of that
I think that's the end of that item, unless somebody has anything they want to add or do. So, okay.
That we wasn't you, that was we, Florida.
I don't have them yet.
Oh, okay.
So,
I have rabbit eyes.
He's got the late bloomers.
Yeah.
That's what I got.
So, okay,
So the next
last two
item.
items are the CTAC, and you think you can have those wrapped up in 10 minutes?
Yes, sir. Wait,
Yes.
okay. So our Teens Work item, really that was just our opportunity to say to the county that we are so proud of our Teens Work Alachua program, which is in partnership with Goodwill Industries and Minority Business Listings. We are, I believe, working with the county. I think County Manager Smart said he would be looking into how we might be able to place some of our students with Fleet this summer. So thank you for making that offer for us. This summer, we were trying to break the program up into two phases. What we found is that the majority of our young people are ages 14 and 15 who come into the program. This is our third year. We're entering into our third summer, and so that means that we may have some of our kids who've been in the program for a couple of years. They are 16, 17 now, and we wanted to give them an opportunity to potentially be placed in internships where these might actually become jobs. As we know, all kids aren't going to college. Some kids do want to get a job right out of high school. So we were looking into organizations that such as Fleet with the county, RTS with the city, and then some of our local industries. I just lost it, the Walmarts, the Coca-Colas, yes, where they might be able to get the internships this summer that could potentially equal jobs. So we wanted to bring that to your attention. Certainly, we heard that CareerSource has a similar internship program.
Yeah, they need to work with you too.
And we are,
Yeah.
that
Good,
was what I
don't
was
they?
going
I
to
mean,
ask.
yeah.
If we could have a little bit more collaboration around it.
Oh, yeah.
CTAC is putting almost $900,000, actually over $900,000 into our Teens Work Alachua program. We're serving between 220 to 300 kids, which is a lot, but not really a lot of young people for that amount of money. And if we want to continue to grow the program, then we're going to need some additional support and partners. We've started conversations with the chamber because we want to look at asking our businesses, you know, what more can they do? And so this was an opportunity for us to just say to you, we look forward to continuing to partner with you, and certainly if there's something that the county can do to assist us, we would appreciate it.
Mr. Prizia.
Yeah, so CareerSource has a separate board, but obviously we all provide them with a lot of services and support and have a big dovetail. And I know some of our board members I used to serve, but and on the board, and I think it would be great. I don't know who's on there now.
Aren't you?
And
Chuck and
Chuck,
I. And
okay.
Yeah.
Maybe if you wouldn't mind taking to the board meeting the idea of the, because I know that not all that.
Put it down.
Okay, perfect. Because I know that not all their youth money was spent. Like
That's
that was
right,
one of
and
the
it's a
areas that was
shortfall.
it was a shortfall.
Yeah,
So
it is.
be a great opportunity to collaborate, and if there's already programs running, to connect the dots. So
Yes.
that would be great. Thank you.
That would
Yeah,
help
and I
get
actually
them
already
out of a hole.
spoke with the director
Phyllis.
about that, yeah, so, and they, you know, our career source is in a little bit of an upheaval right now because we're in the middle of that merger thing.
Expansion.
But she did say that the youth work programs were on her radar. But I am curious about if what type of jobs the county can offer. I know we talked about this briefly, Carl, during the
Public Works.
agenda.
Agenda
Yeah,
review.
Public
Fleet.
Works and Fleet and maybe even, you know, some engineering. I don't know what things are out there.
Yeah. Carl Smart, Deputy County Manager. Parks and Recreation, you know, certainly some community support services, maybe even animal services. Just looking at different departments and possibilities for youth being able to take jobs this summer that can be productive and at the same time earn some income.
And I know we have the program the Empower project that we're working on in collaboration with Santa Fe, and that's going to be mechanics
Yes,
and the diesel
right.
mechanics. So there may be an opportunity to connect the dots with some internships that could lead them into sort of that pipeline for
Places to go, things to
training
do,
through the
jobs
heavy
and
diesel
mentoring.
mechanics and jobs. So I just wanted
Yeah.
to flag that one as another potential opportunity.
And those are high-level jobs, high-paying jobs. Sean McClendon has been working closely with Santa Fe College to get that underway. There'll be an intensive training program those are possibilities too. Yeah.
Members are
Library district,
Yeah,
are they
library.
participating in the?
I know they offered, yeah, okay.
I thought about them a few weeks ago because my daughter worked with them as a rising 16-year-old they have an internship program that's 10 hours a week, 6 weeks.
Just have a job with air conditioning.
Inside.
Carl, is there anything that the county needs from us in order to move forward with that program?
I don't think there's anything right now, Madam Chair, but if we do see that we need something, we'll, come back as quickly as.
A motion or
yeah.
anything, yeah.
You can certainly, you can always direct staff to.
We were participating with them last year.
Right, I just didn't know if
Yeah.
anything had changed. If you need
Nothing's
any
changed.
funding
We'll,
or- Okay.
yeah, we'll do our best to try and place, and we'll keep you informed how we do it, our progress.
Okay, very good.
Did y'all have any luck looking back in the annals of time, because CareerSource or whatever they were called then, they had a program, a summer intern program. It was probably 15 years ago. I think it was called a Yes program or something. And was there any knowledge of the CareerSource people of that program? Because
Brand new people.
I'm sure most of that has gone. The institutional knowledge.
The funding went for it, is what I understood.
Yeah.
For
Yeah,
that
it did.
particular program, yeah.
But they've done it before. Is it possible that
I don't
it
think
could
they've got any of the
happen
same
again?
people. It's a whole new crowd of people over there, I think.
Yeah, it is a whole different crowd, but I was wondering if they had the historical.
Might be able to dig.
Yeah.
I'm not sure right now, but I'll
I did
certainly
ask
ask. Yeah, I'll ask.
What did they say?
They said that they had lost the funding for that program.
Yeah, I don't think
but
they
they
know.
did remember it and they did reference it, but we can continue to look into
the
it.
lessons learned. I mean, I think you're talking about
Good
funding, but
question.
you're also talking about like what worked or
Yeah.
didn't work.
We will certainly continue to discuss it with Career Source, though. I
'Cause
think
it
that's
did
a good
work.
point.
It did work, and it does still exist. JTPA in some form still exists because it's in effect still in Hillsborough and Pinellas County. My nieces and nephews worked in Hillsborough, Pinellas County, and that's why I kind of like started this. Broward is using their Children's Services Council to fund part of this, but the program is running through the Career Source Center in Pinellas and Hillsborough County.
Well, I will definitely
And
ask some
also-
more questions.
And I would hope we can find out something about that, because that would like stretch our dollars a little bit more, and we can employ more people. I'm like concerned, we're spending the trust is investing a lot of money, but we're not helping that many students like that. I'm just worried about the administrative costs that we're spending. But I want us to really be able to employ more students, because I tell you, connecting work and money is.
You're absolutely right.
It is a good skill. It is.
Well, not,
very-
it's, yeah, places to go, things to do, mentors and
And
jobs.
jobs,
Yeah.
I'm telling you. I mean, when I took this to Colin, I'm serious. It was like, look, this is something. I remember my first job. I worked at, it was called CETA then, CETA, right? At the Thomas Center with J.L. Joshua and Elnora Mitchell. And I still to this day keep in touch with Elnora. There were some lessons that I learned. My first job as a 15-year-old that I learned there. And I think this is an investment that we're making. We keep kids out of the way, and parents and the students have had, in the 2 years, have positive things to say.
Yeah, they do.
Commissioner Prizzi.
I guess I wanted to quickly just jump backwards really quick and just say, you know what, one of the things that I heard, it wasn't expressly said, but what I heard in the presentations that we had from our visitors was, Joe Kim in particular, was, you know, that they're paying those kids to play basketball, they're paying them to be
Yes.
coaches, they're paying them
Yes.
to be referees, they're paying them to do the things that they really love to do. And when you get paid to do the thing you love to do, it inspires you to want to do more of it, and it inspires you to realize that you can create value with your skill sets, even if they, you know, I mean, obviously they're not all going to be basketball stars, but it creates a different kind of value. And so I'm wondering, and I know not all kids are ready for like a job, or, you know, and so I just want to throw that out there. I know it's a long shot, but maybe there's something there with a START program or a mini program that would give kids that aren't ready for like a job a chance to do something fun and interesting and show up at a place where they're supposed to be doing something they want to do that isn't hanging out in the streets causing problems. That could be a kind of a baby step towards this more robust program of Teens Work. It's just a thought, you know, and maybe the One City program is the way to go about it. They've already got the model that seems to be working. I don't know, but I just thought of it because I was listening to him and I was writing down, those are jobs. I mean, they're not long jobs and they're not long paying jobs, but they're jobs and they're bringing home money to their families.
Well, that's in Quanda's program pays
Right.
those
Yeah,
kids.
in
you know?
Quanda's program
Yeah.
and Summer Sling.
Yeah, the environmental ambassadors program.
Right, environmental ambassadors and Summer Sling, they're just showing up for camp and getting paid, you know, and they're learning a ton while they're at it, so.
Because even if they start up just showing up for the money,
Yeah, it expands.
it's other stuff. Other
doing
stuff
things-
sticks, right? And then other stuff starts to stick.
Okay, so anything
sorry.
else on that? If not, we'll hear about the YMCA.
Okay. So the YMCA partnership item is really our opportunity to bring to both boards a conversation that CTAC staff had with the YMCA CEO, Angela Howard, and Angela is here, about teen centers. If the CTAC board remembers, we heard when we were doing our listening project, certainly kids want something to do. Our teens need something to do. It ties back to the gun violence. If they had something to do, perhaps we wouldn't be seeing the rise in gun violence. So we had a conversation with Ms. Howard about some of the activities that the YMCA has in other communities, but they haven't necessarily been doing here in ours for a number of different reasons. And she shared with us that they actually have a teen center model, and they are meeting with teens, but it's kind of via a membership with the Y. And so we asked her if we wanted to have a teen center, kind of a county-wide teen center, just to get something up and running. And we wanted to locate it at the Y, since they have the space and are currently doing something similar. What would that look like? And as we continued the conversation, we talked about the fact that they have a humongous gymnasium, right? And it needs some work. And so we're just, again, at the beginnings of a discussion about how we could partner with the Y to create a teen center model that we could have both locate at the Y that is here out in Northwest Gainesville, but also then be able to do activities throughout the county in the different communities. And Angela, I'm not going to bring you up and put you on the spot since we're at the end of the agenda, but I wanted to share that with both boards, certainly with the county, to see if that's something you all would be interested in having maybe staff work with us on. I know that you all have vacant county buildings and things, so we just really want to have a conversation about how we can continue to expand and develop something together.
Cheryl.
I just was curious, are you thinking that in exchange maybe for us funding some of the upgrades that they need, that they in turn would provide scholarships for community kids to join the Y? Is that kind of the idea?
We haven't even gotten into how we would look at that. I mean, we would potentially, the trust could pay for the kids to be able to attend the Y.
And then that funding could be used for their, I was trying to figure out what kind of relationship you were thinking could work there.
Right now,
further ahead than she is.
Yeah, you are.
Sorry, my brain works that way.
We literally had the conversation to talk about the fact that they actually have a model. If we wanted to, well, it might have been the meeting with the city, but when we were talking about vacant buildings or buildings where we could even do something like this, we just kind of were running into a brick wall, Angela. There really weren't, that was the city, there really weren't buildings where we could do something. And in our conversation with Ms. Howard, it's like, oh, there's a facility, they're doing something.
I'm picturing basketball for some reason.
No.
Commissioner Prizzi.
I was just gonna say, I don't know why Hawthorne's on the brain, but Hawthorne's talking about building a community center with Wild Spaces money. That could be a really great place for something like this. I know Archer has a center that they said's underutilized, and that, I'm just thinking about the municipal partnerships.
Moving the programming from community
Central.
to community to community, but we'd have to get it started somewhere. And the conversation was with Ms. Howard as to how we could partner with the Y.
So you ended up in the hot seat after all?
Well, thank you so much, Madam, Mr. Chair, Commission. Well, I wanted to explain a little bit more what's going on, and how this came about. We actually have a Youth and Teen Enrichment Center that's targeted for ages 10 to 16 that started in September of 2021 because of the stats that we saw, the data that we saw from the Alachua County community health assessment related to juvenile arrest. So this program has been going on for 3 years, but with a goal that if we had enough partners, which we are currently, this is a community type based partnership. So we are partnered with Motivate You of North Central Florida, as well as the City of Gainesville Parks and Rec with this. We bring in other outside agencies to do different programs and activities with us, from STEM, culinary, financial literacy, robotics, technology, and just arts, music. We have a slew, and then we utilize UF volunteers. So we've been doing this for a while. And then moving.
How many kids do you have?
Well, in the 3-year span, we've been able to serve 59 children so far. We started on the small because when you change in your model what you're going to do, you have to have people that want to jump on board. So it was gathering and trying to see if we had relationships, if people would come in and support what we were doing. And that takes time to build partnerships and collaborations, because when you do something new that's not being done, everybody doesn't want to be a partner with you. So we are now really progressing. Our partnership level is our list is very long. And this was with the ultimate goal that we would have youth and teen centers all over the county. And so you speak about Hawthorne. We are actually in Hawthorne for our summer camp as well as Archer. So we run summer camp in 4 different locations.
With CTAC?
With CTAC, and we are grateful because it's the rural communities that CTAC is funding. And so we're planning on going even further out, but our Youth and Teen Enrichment Center, the ultimate goal was to be able to drop across the county in the community, because we know transportation is a barrier. And so we want to stop the barrier and let it come to them so that they have access to what they need.
Well, thank you very much, especially helping the outlying areas.
Absolutely.
Because it's Archer, Waldo, and Hawthorne that need help. No. Yes, Commissioner
Do you have a
Cornell.
waiting list, or do you have how much capacity?
Oh, we have lots of capacity. We're in a very, very large facility, and so we have plenty of capacity.
That was your point. Okay.
Yep, and it is open. So I will tell you, as it relates to membership, you do not have to be a member to be a part of we actually have a daily rate for any child to come, any teen from age 10, 16, to come to our Youth and Teen Enrichment Center. So you don't have to be a member, you can just come.
Do you all have a bus?
We do not have a bus. We partner with another nonprofit that if a child needs, we reach out to them and they can go pick them up and drop them up, but we do not have a bus.
Don't you?
You need
got rid of the bus.
We got rid of the bus because you could not get a CDL driver.
This is a cycle I see. in
No,
all
listen,
sorts of
I know,
places,
right?
right?
Okay,
licensing,
all right,
that's
so do we have any questions?
Okay.
Any questions?
I have a question.
Yeah.
You said you served 59 youth I assume a lot of those are over the full 3 years. So that's actually quite a large number. So today you probably have
Right now, we have hold on, let me tell you how many's enrolled. How many we have? We have 18 enrolled right now.
18 right now.
I just want to make a quick note. It's not about this in particular, but I do think it might be worth it next time we do our joint meetings with the municipalities once a year. We make the rounds, and a lot of times what we hear from them is we need resources, we need support, and I don't, maybe their commissioners already know about a lot of these programs, but the stories that I was hearing from the dais and both of our most recent meetings make me think they don't know about these investments. And so it might be useful next time we do our rounds, Marsha, because you need more meetings to go to.
I do attend the League of Cities
Waldo's.
meetings.
You do.
Where I provide updates.
Waldo's
But that's
Thursday.
staff.
Yes, she
Yeah,
does.
Waldo is Thursday.
Well,
Waldo's
it's commissioners.
Yeah.
Yeah, it's all commissioners.
It's a commissioner
You've been
that
Oh,
represents.
that's right. It's the commissioner that represents. Okay.
Each
All right. Well,
municipality.
I guess they've got a hang of it. They just aren't.
But-
Okay. Anyway.
This information in between meetings.
Say that
Website.
again.
Like our website?
There's some
hub,
sort of a
information hub.
information hub in between these meetings
Okay.
for all these big key issues, because there's a lot of programs we
great
talked
idea.
about today, and there's not a.
Central
Yeah.
repository.
Information Central.
Oh, God.
I know.
Okay, so that's a deja vu moment.
Well, it's not a new idea.
It's
I
not,
think-
and
I
it's the
think-
upkeep. It's where is it housed and who keeps it up? It's
Somebody
out
has
of,
to own it.
yeah, it's, somebody has to own it and be willing to
changes.
put in the resource to update it, because it's out of date almost as soon as you put it up.
Yeah,
What's
because
the
we,
name of the
the
faculty member that oversees
CTAC
That's
talked
exactly
about
the
having
point, to
that.
have all these collaborative groups. Like, we're interested in a collaborative group around housing for homeless children. And there's someone else working on a collaborative group for violence prevention. Because you don't know all these silos that are out there, little diamonds out there that are sparkling away that need to get on the same ground, right?
But with each of the Children's Trust RFP process, we're trying our darndest to the key component in all those is collaboration. So hopefully
And
it'll
I
make a
can't
difference.
thank you, Commissioner Pinkeson, former Commissioner Pinkeson, enough for teaching me how important and useful
that kind of collaboration is, no matter what kind of difficult problem you're trying to solve. You need to get out there.
That's why it didn't happen without it.
Yeah.
So, Mr. Smart?
Mr. Chair and Madam Chair, just one quick note. The application period for CAP funding is open now. And I just thought about it when I was hearing about the YMCA item. This may be a good time for a program like that to apply for CAP funding, and other programs that might be listening or watching, nonprofits. Now is the time to apply for that CAP funding. It's a 3-year grant that they can actually receive if their application is approved.
To do capital stuff, or is it just programs? It's just programs, isn't it?
This is programs,
But you can move money from one thing to another, so you can.
Yeah.
Right, yeah.
Well, if you have allocated for a program, you can take that money that was
Right,
programmed and
exactly.
put it towards capital stuff.
Yeah.
So,
Yeah, just wanted to note that.
so we're getting it all worked out for you. So,
Thank you very much, really appreciate it.
any further comments?
I have just one more
Yes.
question. You do swimming lessons for the kids in the
We
summer
do.
too, right?
Yes,
You
we-
transport to.
No, we do not transport, but we will, we have other partners, so people will bring the kids to us, and we do write grants as well for that, so
And you
that
do
we
that
can
at
provide it.
Westside? You do that at Westside?
No, we do it at the YMCA.
Yeah, they have the,
Oh, that's
they have the
right,
pool.
that's right. You've got the YMCA.
Yeah, and we've been to Camp Cuscawilla,
Thank
so
you.
we've
Yeah, that's-
provided swim lessons at
Thank
Camp
you.
Cuscawilla during their
Thank you.
summer
Thank
camp
you.
as well.
Thank you for that.
Mhm.
Okay, so any further, I'm kind of going down the agenda, any further board members of the trust?
No.
Take my
Okay.
thoughts home.
No, if you've got thoughts.
That never happened. That never happened.
I know you're not thought out, so. Okay, all right, so, Madam Chair?
Any further comments from County Commission? I just want to say, I am really good at talking about some things. Sometimes my brain doesn't work so well talking about other things. Thank you for your patience. I appreciate it. When I learn how to say things better or do things better or think about things better, and you guys all help me do that, so thank you. And now it's time for general public comment. Do we have anybody from the public that would like to comment here at the end of the meeting about anything?
I think we outlasted them.
He's been waiting all that time.
No, he got
All that time.
Brave soul. Patient.
My name is John Rollins. I am the Interim Operations Director at the North Central Florida YMCA. I'm the President and CEO of Motivate You of North Central Florida. And I'm grateful for all of the conversation today around the gun violence, the steps that we need to take as a community to address those issues. I do want to caution, and I don't even think caution is the right word, maybe remind those of us who are here and those who may be listening, that even though gun violence is the epidemic that has so much of our attention, it is not the only way that we're losing our children. We're losing children to overdose, losing children to suicide, losing children in traffic accidents. So as much attention as we've devoted to the gun violence, and I think justly so, I don't want us to lose sight that we're still filling up caskets or coffins. I grew up in the country, we call them caskets. We're still filling up coffins, and that cannot be acceptable for us. And so I accept the role to be a voice, not only for those who are suffering because of the gun violence, but also those who may not make their headlines all the time. And so I want to just keep that on the forefront of the minds of those. I believe that we should be considerate of allocating an equal amount of funds to those people who aren't participating in the violence as well. Being more proactive as opposed to just waiting till something has happened. I was doing some simple math over there, and 700 people in a county of over 200,000 people. That's a small percentage of people, so that a lot of people aren't doing bad things. And so the idea of incentivizing some of us with the basketball or with the pain, those may be ways to keep some of those children on track.
Exactly.
And keep them from becoming those statistics that so many of us are concerned about. So those are my thoughts. Thank you, and I don't mind being patient to share that little bit.
Thank you, we
That was
appreciate it.
Great share, thank you.
That's a good parting thought.
Yes, it is.
Yes, very much so. All right, well,
Executive Director Connor.
I just want to add, thank you, Mr. Rollins, for making that statement. I think Claudia left, but the opioid task force that involves all of our municipalities, they are in partnership now with the county, and we are going to be able to, because of funding that the county receives, create a marketing campaign for preventing fentanyl and opioid use. So I didn't
like
want
a
us to leave
project.
without saying that work is taking place on that right
Sounds like
now
a project
as
for this group out of the College of Journalism.
as we speak. Well, I think the organization that the money comes from, Lutheran Services, kind of tells you who you're using, I think. But
Talk to me.
but we are working in partnership. They met last week. They are meeting, so work is being done on that. And then there's also another component where they are trying to utilize a local program to go into the elementary schools to talk to kids about all of this. So thank you for bringing that up, and that's something I'm happy to share with both boards.
Thank you.
thank you, thank you, Marcia. Any other comments? If not, we are now adjourned.
All right, thank you.
Thank you, everybody.
Good meeting.